donkey milk. They spend like thousands of rupees. There's a myth saying ಮೂಗಿಗೆ ಮಸಾಜ್ ಮಾಡಿದ್ರೆ ಮೂಗು ಉದ್ದ ಆಗುತ್ತೆ, ತಲೆಗೆ ಮಸಾಜ್ ಮಾಡಿದ್ರೆ ತಲೆ ರೌಂಡ್ ಆಗುತ್ತೆ.
The beginning of life, where the journey of pregnancy begins. The miraculous 9 months of growth and development within the womb, divided into 3 trimesters. The intense and transformative process of childbirth, bringing new life into the world. The moment of arrival and immediate post-birth care, ensuring the baby's first breaths and vital checks. The critical first weeks of a newborn's life, focusing on adaptation, growth, and early development.
Life begins at birth. Let's begin our podcast by talking about it. When I say birth, it clearly refers to mother. Mother itself is a beautiful emotion, and she's beautifully described as Janini in Sanskrit. Giving birth is a very beautiful, yet miraculous and challenging phase in every female's life. We, here at Janani Seva, are there to help you to go through these challenges. I, Dr. Roshni, welcome you to this show. We have a very renowned and very famous pediatrician and neonatologist, Dr. Shivashankar from Hoyster Hospital. Hello, sir. Welcome to the show.
Thank you, Dr. Roshni and team, and I thank Janani Seva, and I'm pleased to be here. Thanks for the invitation.
Thank you, sir. How are you, sir?
I'm good. How are you?
I'm good, sir. How was your day?
It was a little busy, but I managed to squeeze some time for making this discussion, which is so very important for the parents.
Thank you, sir, for giving your valuable time for us.
My pleasure.
Yes, sir. Today in our discussion, let's talk about the newborn care, do's and don'ts from the day of birth, sir. But before going into the topics, let's understand what kind of normal cases which you see in your day-to-day practice.
All right. So basically, I'm a neonatologist, which means I take care of babies who are sick at birth. So I do come across babies who are born premature. That means avadi purvakinta munche huttiro maklu. That's called prematurity. Babies who are having infection, andre sonku iro maklu. Babies who have high jaundice, andre kamani, okay, ಜಾಸ್ತಿ ಇರೋ ಮಕ್ಕಳು. Babies who have low blood sugars, ಅಂದರೆ ಶುಗರ್ಸ್ ಕಮ್ಮಿ ಆಗಿ ಅದು ತಲೆ ಮೇಲೆ ಏನಾದರೂ ಕಾಂಪ್ಲಿಕೇಶನ್ಸ್ ಆದರೆ, ಅಂದರೆ ನ್ಯೂರಾಲಜಿಕಲ್ ಕಾಂಪ್ಲಿಕೇಶನ್ಸ್ ಆದರೆ, ಅಥವಾ ಮೋಸ್ಟ್ ಕಾಮನ್ ಅಗೇನ್ ಈಸ್ ಬೇಬೀಸ್ ಹು ಡು ನಾಟ್ ಕ್ರೈ ಎಟ್ ಬರ್ತ್. ಅಂದರೆ ಬೇಬಿ ಯಾವ ಮಗು ಹುಟ್ಟಿದ ತಕ್ಷಣ ಅತ್ತಿಲ್ಲ ಅಂತಂದರೆ ಬ್ರೈನ್ ಮೇಲೆ, ಅಂದರೆ ತಲೆ ಮೇಲೆ ಪರಿಣಾಮ ಆಗೋ ಚಾನ್ಸಸ್ ಜಾಸ್ತಿ. ದಿಸ್ ವಿ ಕಾಲ್ ಇಟ್ ಆಸ್ hypoxic ischemic encephalopathy. So these are the most common encounters we have in the day-to-day practice.
ಸೊ ವೈ ಸರ್, ಯಾಕೆ ಈ ಥರ ಕೇಸಸ್ ಆಗುತ್ತೆ? ಹೈಪೋಗ್ಲೈಸಿಮಿ ಆಗಲಿ, ಪ್ರೀ ಮೆಚೂರ್ ಬರ್ತ್ ಆಗಲಿ, ಯಾಕಾಗುತ್ತೆ ಸರ್?
See, every baby is different. Their metabolism is different, what they undergo during the delivery process. ಅವಧಿ ಪೂರ್ವಕ್ಕಿಂತ ಬೇಗ ಹುಟ್ಟಿರೋ ಮಕ್ಕಳು ಅಂದರೆ ಪ್ರಿಮೆಚುರಿಟಿ is these babies are not yet to be outside the womb. They have come out of the womb. So they obviously need, it's a no-brainer, they obviously need neonatal support. Babies who have low blood sugars, all the babies are supposedly able to maintain their blood sugars well. Some of them, andre about 2 to 5 per 100 live births, these kind of babies will not be able to maintain their own blood sugars, or they do not cry at birth due to some complications during delivery. So these are the babies who need intensive care. It may range from mild to moderate to severe intensive care. So some of the babies, I would say the normal ICU admission is about 10%, 10 to 15% max. Okay, what we say is these are the babies who go to NICU care. So that means they need some support or high support for to help them. I mean, we need to help them.
ಯೂಶಲಿ ಸರ್ ಇವಾಗಿನ ಕಾಲದಲ್ಲಿ ಪ್ರೀ ಮೆಚೂರ್ ಬೇಬಿ ತುಂಬ ಕಾಮನ್ ಆಗಿ ನೋಡ್ತಾ ಇದ್ದೀವಿ. ಇಸ್ ಇಟ್ ಬಿಕಾಸ್ ಆಫ್ ದ ಮದರ್, ಅವ್ರ ಪ್ರೆಗ್ನೆನ್ಸಿ ಪೀರಿಯಡಲ್ಲಿ ಏನಾದರೂ ಅವರಿಗೆ ಡೈಟ್ರಿ ಚೇಂಜಸ್ ಆಗಲಿ, ಕರೆಕ್ಟ್ ನ್ಯೂಟ್ರಿಷನ್ ಸಿಗಲಿಲ್ಲ, ಇಲ್ಲ ಅವ್ರ ಸ್ಟ್ರೆಸ್ ಲೆವೆಲಿಂದ ಏನಾದರೂ ಇದು ಎಫೆಕ್ಟ್ ಆಗುತ್ತಾ ಸರ್?
See, prematurity, first of all, to define that itself, we need to know when we call it as prematurity. Normally 37 ವಾರ ಅಂದರೆ 37 weeks gestation, ಅಂದರೆ ಗರ್ಭಿಣಿ ಆಗಿರೋ ತಾಯಿ 37 ವಾರಕ್ಕಿಂತ ಮೊದಲು ಡೆಲಿವರಿ ಮಾಡಿದರೆ, ಬಿಫೋರ್ 37 weeks ವಿ ಕಾಲ್ ಇಟ್ ಆಸ್ ಪ್ರಿಮೆಚುರಿಟಿ. ಹಾಗಂತ ಎಲ್ಲ ಪ್ರೀಮೆಚೂರ್ ಬೇಬೀಸ್ಗೆ ICU ಬೇಕಾಗಲ್ಲ. ಸೊ ಇಟ್ಸ್ ಬಿಫೋರ್ 34 weeks ವಿ ಟೆನ್ ಟು ಅಡ್ಮಿಟ್ ದೆಮ್. India, in terms of prematurity, tops the list number of babies who are born premature, which is about 10 to 15% range. ಅಂದರೆ 100ಕ್ಕೆ 10ರಿಂದ 15 ಮಕ್ಕಳು ಪ್ರೀಮೆಚೂರ್ ಆಗಿ ಹುಡ್ತಾರೆ. ಅದು ನಮ್ಮ ದೇಶದಲ್ಲಿ, ವಿಚ್ ಈಸ್ ವೆರಿ ಹೈ ಫಾರ್ ನಂಬರ್. ಇಟ್ ಕುಡ್ ಬಿ ಡ್ಯೂ ಟು ಮೆನಿ ರೀಸನ್ಸ್. ಒನ್ ಈಸ್ ಡ್ಯೂ ಟು ಮ್ಯಾಟರ್ನಲ್ ರೀಸನ್ಸ್, ಅಂದರೆ ಮ್ಯಾಟರ್ನಲ್ ಮಾಲ್ ನ್ಯೂಟ್ರಿಷನ್. ಮದರ್ಗೆ ಏನಾದರೂ ಕಾಂಪ್ಲಿಕೇಶನ್ಸ್ ಇದ್ದರೆ, ಅಂದರೆ ಪ್ರೆಗ್ನೆನ್ಸಿ ಹೈಪರ್ ಟೆನ್ಷನ್, ಅಂದರೆ ಪ್ರೆಗ್ನೆನ್ಸಿ ಇಂಡ್ಯೂಸ್ಡ್ ಹೈಪರ್ ಟೆನ್ಷನ್ ಡ್ಯೂರಿಂಗ್ ಡೆಲಿವರಿ ಟೈಮಲ್ಲಿ, ಇಫ್ ಶಿ ಹ್ಯಾಸ್ ಎನಿ ಹೈಪರ್ ಟೆನ್ಷನ್, ಇಫ್ ಶಿ ಹ್ಯಾಸ್ ಇನ್ಫೆಕ್ಷನ್, ಬಾಡಿನಲ್ಲಿ ಎಲ್ಲೇ ಇನ್ಫೆಕ್ಷನ್ ಆದರೂ ಮೋಸ್ಟ್ಲಿ ಯೂರಿನರಿ ಇನ್ಫೆಕ್ಷನ್ ಕಾರಣದಿಂದ ಪ್ರಿಮೆಚುರಿಟಿ ಆಗ್ತಾರೆ. ಇಲ್ಲ ಅಂತಂದರೆ ಬೇಬಿಗೆ ಏನಾದರೂ ಒಳಗಡೆ ಹೊಟ್ಟೆಯಲ್ಲಿ ತೊಂದರೆ ಇದ್ದರೆ, ಎಸ್ಪೆಷಲಿ ಈಗ ಟ್ವಿನ್ಸ್ ಪ್ರಿಮೆಚುರಿಟಿ ಜಾಸ್ತಿ ಇರುತ್ತೆ. ಇಲ್ಲ ಬೇಬೀಸ್ಗೆ ಏನಾದರೂ ಕಂಜನೈಟಲ್ ಅನಾಮಲೀಸ್ ಅಂತ ಹೇಳ್ತೀವಿ, ಅದು ಆದರೆ ತೊಂದರೆ ಇರುತ್ತೆ. ಇಲ್ಲ ಅಂತಂದರೆ ಪ್ಲಸೆಂಟಲ್ ಪ್ರಾಬ್ಲಮ್ಸ್, ಪ್ಲಸೆಂಟಾ ಇಸ್ ನಾಟ್ ಕಂಪ್ಲೀಟ್ಲಿ ಹೆಲ್ದಿ, ಆವಾಗ ಪ್ರಿಮೆಚುರಿಟಿ ಆಗೋ ಚಾನ್ಸಸ್ ಜಾಸ್ತಿ ಆಗಿರುತ್ತೆ. Some of the times we will be able to know the cause. Most of the times we won't be able to know the cause.
Okay, sir.
So it's unknown causally. Most of the times we won't be able to know the cause of prematurity. Nam deshadalli, compared to other countries, we have higher number of premature babies that who are born every day throughout the country.
Okay, sir. Coming to the parenting ಅಂದ್ರೆ ದೊಡ್ಡ ರೆಸ್ಪಾನ್ಸಿಬಿಲಿಟಿ.
Exactly.
ಇನ್ನೇನು ಡೆಲಿವರಿ ಡೇಟ್ ಹತ್ತಿರ ಬರ್ತಾ ಇದೆ ಅಂತ ಇದ್ದಂಗೆ ಬೋತ್ ಮದರ್ ಆ್ಯಂಡ್ ಫಾದರ್ ವಿಲ್ ಹ್ಯಾವ್ ದೇರ್ ಓನ್ ಕನ್ಫ್ಯೂಷನ್ಸ್ ಆಗಲಿ, ದೇರ್ ಓನ್ ಡೌಟ್ಸ್ ಆಗಲಿ, ದೆ ವಿಲ್ ಬಿ ಸ್ಟ್ರೆಸ್ಡ್ ಇನ್ ದಿಯರ್ ಓನ್ ವೇ. ಸೊ ಎಟ್ ದ ಟೈಮ್ ಆಫ್ ಡೆಲಿವರಿ ಏನು ಅವರಿಗೆ ಗೊತ್ತಿರಬೇಕು? ದೀಸ್ ಆರ್ ದ ಸ್ಟ್ರಿಕ್ಟ್ ಪ್ರೋಟೋಕಾಲ್ಸ್, ಮದರ್ಗಾಗಲಿ ಫಾದರ್ಗಾಗಲಿ ಗೊತ್ತಿರಬೇಕು ಅನ್ನೋದಾದರೆ.
See, once you are nearing to your expected date of delivery, you will always have in mind on which hospital to visit. ಅದು ಆಲ್ರೆಡಿ pre-decided ಆಗಿರುತ್ತೆ. So they need to consult with their obstetrician on where they are going to deliver, ಎಲ್ಲಿ ಡೆಲಿವರಿ ಮಾಡಬೇಕು, ಅಲ್ಲಿ ಡೆಲಿವರಿ ಫೆಸಿಲಿಟೀಸ್ ಹೇಗಿದೆ, ಓಕೆ, that they need to check. Because for any baby to be delivered, you need to have bare minimum facilities in the hospital. Okay, so what are those bare minimum facilities? Andre, any baby needs resuscitation. 90% ಅಂದರೆ 100ರಲ್ಲಿ 90 ಮಕ್ಕಳಿಗೆ ಏನು ಸಪೋರ್ಟ್ ಬೇಕಾಗಲ್ಲ, ರೆಸ್ಪಿರೇಟರಿ ಸಪೋರ್ಟ್ ಬೇಕಾಗಲ್ಲ. ಅಂದರೆ ಶ್ವಾಸಕೋಶ ಪುನರ್ಜೀವನ ಕೊಡೋಕ್ಕೆ ದೇ ಡೋಂಟ್ ನೀಡ್ ಎನಿಥಿಂಗ್. 10% ಅಪ್ ಟು 10% ಆಫ್ ದ ಬೇಬಿ ನೀಡ್ ಸಮ್ ಸಪೋರ್ಟ್. 100 ಅಂದರೆ 100ಕ್ಕೆ 10 ಮಕ್ಕಳಿಗೆ ಸ್ವಲ್ಪ ಸಪೋರ್ಟ್ ಕೊಟ್ಟರೆ ಮಾತ್ರ ಉಸಿರಾಡ್ತಾರೆ. ಒಂದು ಮಗು 100ಕ್ಕೆ 1 ಮಗುಗೆ ಡಾಕ್ಟರ್ ಇಲ್ಲ ಅಂತಂದರೆ ಆ ಮಗು ಉಳಿಯೋ ಚಾನ್ಸಸ್ ತುಂಬಾ ಕಮ್ಮಿ. ಸೊ ಎನಿಬಡಿ ಹೂ ಕ್ಯಾನ್ ರಿಸಸಿಟೇಟ್, ಮೋಸ್ಟ್ಲಿ pediatrician, neonatologist is a luxury during delivery. If not, a nurse whose skill and training is done on resuscitation. ಅಂದರೆ ಆ ನರ್ಸ್ದು ಅವ್ರದ್ದು ತರಬೇತಿ ಆಗಲಿ ಇಲ್ಲ ಕೌಶಲ್ಯಗಳು ರಿಸಸಿಟೇಷನ್ ಪುನರ್ಜೀವನ ಕೊಡಲಿಕ್ಕೆ ಇರಬೇಕು. ಇದು ಬೇರ್ ಮಿನಿಮಮ್ ಫೆಸಿಲಿಟಿ ಆ ಆಸ್ಪತ್ರೆಯಲ್ಲಿ ಇರೋದು ಇಂಪಾರ್ಟೆಂಟ್.
ಸೊ ದೇ ಹ್ಯಾವ್ ಟು
ಲುಕ್ ಫಾರ್ ದಿಸ್ ಆ್ಯಂಡ್ ಆಲ್ಸೋ ಫಾರ್ ದಿ ಮದರ್ ಟು ಹ್ಯಾವ್ ಎನಿ ಕಾಂಪ್ಲಿಕೇಶನ್ಸ್, ಟು ಡೀಲ್ ವಿತ್ ದ ಕಾಂಪ್ಲಿಕೇಶನ್ಸ್ ಲೈಕ್ ಪೋಸ್ಟ್ಪಾರ್ಟಮ್ ಬ್ಲೀಡಿಂಗ್. ಇಮಿಡಿಯೇಟ್ಲಿ ಡೆಲಿವರಿ ಆದ ತಕ್ಷಣ ಕೆಲವೊಂದು ತಾಯಂದ್ರಲ್ಲಿ there will be excessive bleeding. So, and a bare minimum ICU facility, although it is not mandatory, but to stabilize the mother if she has excessive bleeding, because that's one of the most common cause of maternal mortality. ಅಂದರೆ ತಾಯಿಗೆ ಗರ್ಭಿಣಿ ಆಗೋ ತಾಯಿ ಡೆಲಿವರಿ ಆದಮೇಲೆ ಪ್ರಾಣಕ್ಕೆ ಅಪಾಯ ಮಾಡೋದು ಅಂದರೆ ಪೋಸ್ಟ್ಪಾರ್ಟಮ್ ಹೆಮರೇಜ್, ಅಂದರೆ ತುಂಬ ಬ್ಲೀಡಿಂಗ್ ಆಗೋದು, ಬ್ಲೀಡಿಂಗ್ ಸ್ಟಾಪ್ ಆಗೋದಿಲ್ಲ. ದಿಸ್ ಈಸ್, ಯು ಡೋಂಟ್ ನೋ ವಿಚ್ ಮದರ್ ಕ್ಯಾನ್ ಅಂಡರ್ಗೋ ಆಲ್ ದಿಸ್, ಕ್ಯಾನ್ ಹ್ಯಾವ್ ದಿಸ್ ಕಾಂಪ್ಲಿಕೇಶನ್. ಸೊ ಅದಕ್ಕೆ ಸ್ಟೆಬಿಲೈಸ್ ಮಾಡೋ ಫೆಸಿಲಿಟಿ ಕೂಡ ಇರಬೇಕು. ಸೊ ತಾಯಿಗೆ ಮಗುವಿಗೆ ಸೇಫ್ಟಿ, ಸೊ ದ್ಯಾಟ್ ದ ಬೇಬಿ ಆ್ಯಂಡ್ ಮದರ್ ಆರ್ ಸೇಫ್. ಈ ಫೆಸಿಲಿಟಿ ಮ್ಯಾಂಡೇಟರಿ ಆಗಿ ಇರೋದು ಎಲ್ಲ ತಾಯಿ ತಂದರಿಗೆ ಅರ್ಥ ಆಗಿರಬೇಕು. ಆಮೇಲೆ ದೇ ಶುಡ್ ಎನ್ಕ್ವೈರ್ ದಟ್ ದೀಸ್ ಫೆಸಿಲಿಟೀಸ್ ಆರ್ ದೇರ್ ಇನ್ ದ ಹಾಸ್ಪಿಟಲ್ ಬಿಫೋರ್ ದೇ ಗೆಟ್ ಅಡ್ಮಿಟೆಡ್.
ಆ್ಯಂಡ್ ಇನ್ನೊಂದು ಸರ್, ಒಬ್ಬಳು ತಾಯಿ ಶಿಲ್ ಗೋ ಥ್ರೂ ಹಾರ್ಸ್ ಆಫ್ ಲೇಬರ್, ಲೇಬರ್ ಆಗಲಿ ಲೇಬರ್ ಪೇನ್ ಆಗಲಿ.
Yes.
ಬಟ್ ಒಂದ್ಸತಿ ಬೇಬಿ ಹೊರಗಡೆ ಬಂದು ಡೆಲಿವರ್ ಆಗಿದ ತಕ್ಷಣ ಶಿಲ್ ಫೊಗೆಟ್ ಆಲ್ ದ ಪೇನ್ ಲಿಸ್ನಿಂಗ್ ಟು
Exactly.
ದ ಬೇಬೀಸ್ ಕ್ರೈ.
Yes.
ಸೊ ಆ ಮೂಮೆಂಟಲ್ಲಿ ಅಟ್ ದಟ್ ಮೂಮೆಂಟ್ ತಾಯಿ ಏನು ಮಾಡಬೇಕು? ವಾಟ್ ಆರ್ ದ ಇಮಿಡಿಯೇಟ್ ಥಿಂಗ್ಸ್ ಶಿ ಶುಡ್ ಡೂ?
Correct. So normal delivery, see, that's depends on the mode of delivery also. Okay, normal delivery adre, I mean, she will be, once the baby is delivered, she will have enough time, and she, once the pain gets relieved dramatically. So avaga there is a process. During that process, we do something called delayed cord clamping.
ಓಕೆ.
ಅಂತಂದ್ರೆ ತಾಯಿಯಿಂದ ಮಗುವಿಗೆ the placenta to baby connection, ಹೊಕ್ಕಳ ಬಳ್ಳಿ or umbilical cord should be not cut immediately.
ಓಕೆ.
We should not disconnect immediately. That we need to wait for minimum of 60 seconds. We call it as delayed cord clamping. Idrinda extra amount of blood which is in the placenta, about 20 to 25% of the blood which is in the placenta goes to the baby from the mother. Okay, that will give extra benefits to the baby, which are short term and long term.
ಸೊ ದಟ್ ಪೀರಿಯಡ್ ಇಸ್ ವೆರಿ ಇಂಪಾರ್ಟೆಂಟ್. 1 minute.
First 1 minute, we also call it as golden minute for various reasons. Or in that golden minute, we do some procedures like this, which is delayed cord clamping. It's a practice, I would say. Delayed cord clamping. Once that is done, 60 minutes aadmele, you can cut the cord and put the baby on the mother's skin. That means on the mother's chest. ತಾಯಿ ಎದೆ ಮೇಲೆ ಹಾಕಿದ್ರೆ ಅದಕ್ಕೆ ಸ್ಕಿನ್ ಟು ಸ್ಕಿನ್ ಕಾಂಟ್ಯಾಕ್ಟ್ ಅಂತ ಹೇಳ್ತೀವಿ. The advantage of this are many.
Okay.
The first would be is it will help bond. All right, so the baby's mother's temperature, which is warm, will be transferred to the baby.
Okay.
So baby will have less risk of hypothermia. It will initiate the bond between the mother and the baby. It will help baby to initiate the breastfeeding. So not only initiate but also to sustain the breastfeeding. So ಎಲ್ಲಾನು baby's blood sugar ಕಮ್ಮಿ ಆಗೋದು chances will be less, and stabilization of baby's heart rate, respiratory rate or temperatures are much more in babies who undergo skin to skin contact than in babies who do not undergo skin to skin contact immediately. So at least for a few minutes, but with a caveat, I would say, is the hospital has the facilities to do so, or the resources to do so, or a person to do so. ನೀವು ರಿಸಸಿಟೇಷನ್ ಫೆಸಿಲಿಟೀಸ್ ಇಲ್ಲ ಅಂತಂದರೆ ಇದು ಮಾಡೋದು ಕಷ್ಟ ಆಗುತ್ತೆ. ಯು ಶುಡ್ ಹ್ಯಾವ್ ಎ ನರ್ಸ್ ಹೂ ಶುಡ್ ಬಿ ಏಬಲ್ ಟು ಟೇಕ್ ದಟ್ ಬೇಬಿ, ಪುಟ್ ಆನ್ ದ ಮದರ್ ಸ್ಕಿನ್ ಟು ಸ್ಕಿನ್, ಏಬಲ್ ಟು ಅಸೆಸ್ ದ ಬೇಬಿ ಈಸ್ ಆಲ್ ರೈಟ್ ಡ್ಯೂರಿಂಗ್ ದಿಸ್ ಪ್ರಾಸೆಸ್ ಆ್ಯಂಡ್ ಇನಿಷಿಯೇಟ್ ದ ಬ್ರೆಸ್ಟ್ ಫೀಡಿಂಗ್. ಬರೀ ಒಬ್ಬರೇ ನರ್ಸ್ ಇದ್ದರೆ she will be focusing on mother first to take out the placenta and stabilize the mother, relieve her of pain. Avaga baby, to take care of the baby, it becomes very difficult. These are the best practices, but we need some resources, especially human resource and the facilities to do so, to get the maximum benefit out of it. Baby breathe madila antandre, this will not have any impact. First is to save the life.
Yes.
If baby has not taken any breath after delivery, doing this makes no sense. Okay, so first baby cry aita, baby is stable ಆದಮೇಲೆ then you go for delayed cord clamping. Baby stable ಇಲ್ಲ ಅಂದರೆ delayed cord clamping ಮಾಡೋದು. So you should be very aware that you should do delayed cord clamping. For all the parents, you should ask your obstetrician, but you should not be obsessed, because if the baby is not well, then the first priority, the precedence is always to give the baby breath and not delayed cord clamping or skin to skin. But these are the best practices. If the baby is stable, it should be done.
Okay, sir. Normal baby weight ನೋಡೋದಾದ್ರೆ, what is the normal baby weight, sir?
See, in India, it's about 2.5 to 3.5 kgs. Anything below that, we call it as low birth weight. Or most of the times, compared to the Western countries, our babies' birth weights are slightly lesser because of the maternal and genetic component also in that. So our babies' weight compared to Western countries are less, but our average weight in Indian is 2.5 to 3.5 kilos. Okay, so that's considered to be normal, up to 4 kilos. Yeah.
And one more misconception which I've seen is C-section ಆದಾಗ ತಾಯಿ she's usually in semi-conscious state or she's completely in no conscious state. So ಆ ಟೈಮಲ್ಲಿ when the nurse handles the baby to the relatives ಇಲ್ಲ ತಂದೆಗೆ ಕೊಟ್ಟಾಗ ಫಸ್ಟ್ ಥಿಂಗ್ ದೇ ಡೂ ಇಸ್ ಬೇಬಿನ ವಾಶ್ ಮಾಡಬೇಕು, ಬೇಬಿಗೆ ಸ್ನಾನ ಮಾಡಿಸ್ಬೇಕು ಬಿಕಾಸ್ ದ ಬೇಬಿ ಇಸ್ ಡರ್ಟಿ. ಅದು ಒಂದಿದೆ. ಇನ್ನೊಂದು ಏನು ಮಾಡ್ತಾರೆ ಅಂದರೆ ಅಕ್ಕಪಕ್ಕದಲ್ಲಿ ಯಾರಾದರೂ ಇದ್ದರೆ ಹನಿ ಹಾಕಬೇಕು. So they get somebody's ring and dip it in the honey and give it to the baby. So the baby prosper ಆಗುತ್ತೆ throughout the life ಅನ್ನೋದು ಇದು ಒಂದು ನಂಬಿಕೆ ಇದೆ. ಇನ್ನೊಂದಿದೆ ಡಾಂಕಿ ಮಿಲ್ಕ್. They spend like thousands of rupees on that. ಅಲ್ಲಿಂದ ಇಲ್ಲಿಂದ ತೊಗೊಂಬಂದು ದೇ ಸ್ಟಾರ್ಟ್ ಫೀಡಿಂಗ್ ಡಾಂಕಿ ಮಿಲ್ಕ್. ತಾಯಿ ಹಾಲು ಕುಡಿಸೋಕ್ಕಿಂತ ಮುಂಚೆ ಸೊ ದಟ್ ಮಗು ಬ್ರೈನ್ ಡೆವಲಪ್ಮೆಂಟ್ ಆಗುತ್ತೆ, ಮಗುಗೆ ಇಮ್ಯುನಿಟಿ ಜಾಸ್ತಿ ಆಗುತ್ತೆ. ಆ್ಯಂಡ್ ಇನ್ನೊಂದು ಐ ಫೀಲ್ ವೆರಿ ಫನಿ ದಟ್ ಈಸ್ ಶುಗರ್ ವಾಟರ್. ದ ಬೇಬಿ ಈಸ್ ಗಾನ್ ಥ್ರೂ ಅ ಲಾಡ್ ಆಫ್ ಪ್ರಾಸೆಸ್, ಡೆಲಿವರಿ ಪ್ರಾಸೆಸ್, ಸುಸ್ತಾಗಿರುತ್ತೆ. ಸೊ ತಾಯಿಗೆ ಇನ್ನೂ ಹಾಲು ಬಂದಿಲ್ಲ, ಶುಗರ್ ನೀರು ಕುಡಿಸ್ಬಿಡೋಣ.
Correct.
ಸೊ ವಾಟ್ ಡು ಯು ಸೇ ಅಬೌಟ್ ದೀಸ್ ಪ್ರಾಕ್ಟಿಸಸ್?
So, absolutely, of course, these practices are very wrong. I mean, at the outset, these are very wrong and harmful. All right. So, ಅದಕ್ಕೆ to go in details, it is called prelactal feeds. ಅಂದರೆ ತಾಯಿ ಹಾಲು ಕೊಡೋಕ್ಕಿಂತ ಮುಂಚೆನೇ ಸ್ಟಾರ್ಟ್ ಮಾಡಿರುವ ಪದಾರ್ಥಗಳು ಪ್ರೀಲ್ಯಾಕ್ಟಿಯಲ್ ಅಂತ ಹೇಳ್ತೀವಿ. ಸೊ ದೇರ್ ಆರ್ ವೇರಿಯಸ್ ಕಾಂಪೊನೆಂಟ್ಸ್. ಅಂದರೆ ಶುಗರ್ ವಾಟರ್ ಆಗಲಿ, ಆ್ಯಸ್ ಯು ಟೋಲ್ಡ್, ಅಬ್ಸಲ್ಯೂಟ್ಲಿ ವಾಟ್ ಎವರ್ ಯು ಟೋಲ್ಡ್ ಇಸ್ ಆನ್ ಸ್ಪಾಟ್. ಇಟ್ಸ್ ಕುಡ್ ಬಿ ಹನಿ, sugar water, donkey milk, or any other, the dry fruits powder or anything. The concept of them is that baby is tired and babies will have low sugar is correct. Baby is tired during delivery. The amount of stress the baby undergo during delivery and the amount of adrenaline the baby produces during delivery is highest it can ever produce in the entire lifetime. Okay, you or me going to produce adrenaline in any stress situation is nothing compared to what a baby produces during a delivery, normal delivery. All right, so the baby is definitely undergoing stress. There is no doubt about it. And the baby's sugars tend to be low is also no doubt about it. Okay, before delivery there is a constant supply of blood sugar from the mother to the baby through a umbilical cord or hokkala balli. ಅದರಿಂದ ಕಾನ್ಸ್ಟೆಂಟ್ ಆಗಿ ಶುಗರ್ ಸಪ್ಲೈ ಆಗ್ತಾ ಇರುತ್ತೆ. Suddenly, when you cut the cord, there is chances that the baby's blood sugar will come down. That is absolutely fine. The logic is fine. But there is a natural best medicine available for that is breast milk. Giving prelactal feeds will not only prevent to get that breast milk, but also carries a high risk of infection, especially honey, which not only makes the baby sick, but also can kill a baby. Especially honey, sugar water. In our practice, any neonatologist or a pediatrician would have seen handful number of babies who have not made it because of these practices. All right. So whatever explanation can be given that why they gave it, eventually the babies are the sufferers because the logic is correct why they want to give.
But the method is wrong.
The method is not. So. But it's the ignorance. It's not their fault. It's the ignorance and lack of education. That's it. I mean, there is nobody to blame to. But these are practices which are widely percolated in our society. So I think right education will only help to prevent this and reduce the neonatal mortality. Okay.
One more myth, sir. ನಾನು ನೋಡಿರೋದು ಫಸ್ಟ್ ಮಿಲ್ಕ್ ಏನಿದೆ, ದ ಎಲ್ಲೋ ಗೋಲ್ಡನ್ ಮಿಲ್ಕ್. ಸೊ ಕೊಲೆಸ್ಟ್ರಮ್ ಅಂತ ಏನು ಕರಿತೀವಿ ಮೆಡಿಕಲ್ ಲ್ಯಾಂಗ್ವೇಜಲ್ಲಿ. ಸೊ ಕೆಲವೊಂದು ಫ್ಯಾಮಿಲೀಸಲ್ಲಿ ದೇ ಡೋಂಟ್ ಲೆಟ್ ದ ಮದರ್ ಫೀಡ್. ಇದು ತುಂಬ ಥಿಕ್ ಇದೆ, ಇದು ಡೈಜೆಸ್ಟ್ ಆಗಲ್ಲ ಮಗುಗೆ, ಯು ಹ್ಯಾವ್ ಟು ಎಕ್ಸ್ಪ್ರೆಸ್ ಇಟ್ ಆ್ಯಂಡ್ ಯು ಹ್ಯಾವ್ ಟು ಜಸ್ಟ್ ಡಿಸ್ಕಾರ್ಡ್, ಕೊಡಬಾರ್ದು.
Exactly.
ಸೊ ಇಸ್ ಇಟ್ ರೈಟ್ ಸರ್ ಟು ಡೂ ದಿಸ್?
ಕೊಲೆಸ್ಟ್ರಮ್ ಕನ್ನಡದಲ್ಲಿ ಗಿಣ್ಣದ ಹಾಲು ಅಂತ ಹೇಳ್ತೀವಿ. ನೀವು ಹಸು ಹಾಲು ಕೊಡಿದ್ರೆ ಎವ್ರಿ ಒನ್ ಲೈಕ್ಸ್ ದಟ್. ಆಲ್ ರೈಟ್. ಸೊ ಇಫ್ ಯು ಟೇಕ್ ದಿ ಫಸ್ಟ್ 3 days ಹಸು ಮಗು ಹಾಕಿದ್ಮೇಲೆ ದೆನ್ ಯು ವಾಂಟ್ ದಟ್ ಮಿಲ್ಕ್ ಟು ಬಿ, ಬಿಕಾಸ್ ಇಟ್ ಈಸ್ ರಿಚ್ ಇನ್ proteins, it is rich in immunoglobulins. It's a thick yellow milk. It's also called as liquid gold. The reason it is called gold because it has that importance. It has a rich protein and immunoglobulins andre antibodies or pratikayagalu anta heltivi, which not only helps the baby fight infections, but it stays in the baby for the rest of the life to fight against infections. So the quantity is less, although the quantity of colostrum is less produced in the first 2 to 4 days of life. It may be about say 30 to 60 ml or sometimes 100 ml, max of 100 ml can be produced. But the quality is much superior than any other milk. So discarding that, you are depriving, not only depriving your babies of course the nutrition, but also the long term protection. ಅಂದರೆ ಅದರಿಂದ ಏನು ಆ್ಯಂಟಿಬಾಡೀಸ್ ಇರುತ್ತೆ, immunoglobulins ಇರುತ್ತೆ, those are not going to the baby. You are depriving your baby of such a wonderful nutrition produced by the nature, and it is of no cost. So I would recommend everyone is, as soon as the baby is born, make sure the colostrum is expressed, how much ever quantity, it may be 2 ml, 4 ml, 10 ml, 20 ml, doesn't matter. Just go take that milk and put it in the baby's mouth, or just apply and paint it. Colostrum painting anta ಹೇಳ್ತೀವಿ. For babies who are 1 kilo, even in an ICU, we ask the mother to give that milk and paint the mouth to get the beneficial effects. So it is such an important aspect in the initial feeding context.
ಇನ್ನು ಕೆಲವೊಂದು ಕೇಸಸಲ್ಲಿ ವೆನ್ ದ ಮದರ್ ಇಸ್ ನಾಟ್ ಲ್ಯಾಕ್ಟೇಟಿಂಗ್ ಯೆಟ್, ಸೊ ಕೌಸ್ ಮಿಲ್ಕ್ ಕೊಡೋದು, ಫಾರ್ಮುಲಾ ಮಿಲ್ಕ್ ಓಕೆ, ದಟ್ ಇಸ್ ಟು ಸಮ್ ಎಕ್ಸ್ಟೆಂಟ್ ಇಟ್ಸ್ ಓಕೆ, ಬಟ್ ಕೌಸ್ ಮಿಲ್ಕ್, does it affect baby's digestion, sir? Is it okay? Is it the same quality like mother's milk?
Cow's milk is made for calves, so it's not for the babies. So until 1 year, it is absolutely no to give cow's milk. All right. So in the newborn period, it's absolutely contraindicated to give cow's milk, because baby cannot digest that, because the amount of protein, the protein size is bigger in cow's milk, so babies cannot digest that. If the mother is sick, she's in ICU, she's not able to produce breast milk, or for whatsoever reasons breast milk cannot be given, although those reasons are very few. In that case, an appropriate, after discussing with the parents, you give something called formula milk, any formula for that matter, because this is of course made of cow's milk, but it is degraded to, the proteins are broken down so that the baby will be able to digest that formula milk. Giving cow's milk, goat's milk, donkey milk, or any other buffalo's milk is absolutely no, because babies cannot digest these kind of milks. So it's a no.
ಕಂಪ್ಲೀಟ್ ಬಿಗ್ ನೋ.
Complete no.
ಓಕೆ, ಸೊ ಇನ್ನೊಂದು ನೋಡೋದಾದರೆ, ಇವಾಗ ಮಗು ತಾಯಿ ಹೊಟ್ಟೆಲಿದ್ದಾಗಿಂದ ಹೊರಗಡೆ ಬಂದಾಗ, ಸೊ ಇಟ್ ಟೇಕ್ ಸಮ್ ಟೈಮ್ ಟು ಅಡ್ಜಸ್ಟ್ ಅಲ್ವಾ? ಸೊ ಆ ಪೀರಿಯಡ್ ಬಗ್ಗೆ ಏನು ಹೇಳ್ತೀರಾ? ಎಷ್ಟು ಹೊತ್ತಿರ್ಬೋದು, ಆ್ಯಂಡ್ ಅದಕ್ಕೆ ಏನೇನು ಎನ್ವೈರ್ಮೆಂಟಲ್ ಚೇಂಜಸ್ ಆಗ್ಬೋದು ಅಂತ?
So it's a very good question on what you are talking about, is the how the baby gets transitioned from in utero to outside. ಅಂದರೆ ಭ್ರೂಣ ಇಂದ ನವಜಾತ ಶಿಶು ಆಗಲಿಕ್ಕೆ ಇದು ತುಂಬ ಟ್ರಾನ್ಸಿಷನ್ ಪೀರಿಯಡ್ ಅಂತ ಹೇಳ್ತೀವಿ. ಇದಕ್ಕೆ ಪುನರಾವರ್ತನಾ ಪೀರಿಯಡ್. ಓಕೆ, ನಾರ್ಮಲಿ ಹೊಟ್ಟೆಲಿರುವಾಗ ಹೊಟ್ಟೆ ರೂಮ್ ಟೆಂಪರೇಚರ್ ಇಸ್ ಅಬೌಟ್ 30 ಡಿಗ್ರಿ ಸೆಲ್ಸಿಯಸ್. ದ ರೂಮ್ ಟೆಂಪರೇಚರ್ ಇನ್ ಎನಿ ಡೆಲಿವರಿ ರೂಮ್ ಇಸ್ 26 to 28. So it's a drastic 10 to 12 degree temperature reduction. Umbali, it's an hypoxic environment. ಅಂದರೆ ನೀವು ಟಾಪ್ ಆಫ್ ಮೌಂಟ್ ಎವರೆಸ್ಟ್ ಹೋದಾಗ ಏನು ಆಕ್ಸಿಜನ್ ಇರುತ್ತೆ ಅದೇ ಆಕ್ಸಿಜನ್ ಹೊಟ್ಟೆಲಿರುತ್ತೆ. Suddenly they have to get adjusted to that environment which outside. Thirdly, their lungs are not working because the placenta is taking care of the lung gas exchange. Bari 10% of blood, that is 10% of the blood, goes to the lungs inside the utero. Once they are born, 100% of the blood has to go to the lungs. And the heart, normally in you and me, left side of the heart is predominant, which is like superior anta ಹೇಳ್ತೀವಿ, which works more than the right side. Inside the utero, the right side works more than the left. So ಈ ಎಲ್ಲ ಟ್ರಾನ್ಸಿಷನ್ ಇಷ್ಟು ಬೇಗ ಆಗುತ್ತೆ, ಇಟ್ ಹ್ಯಾಪನ್ಸ್ ಸೋ ಕ್ವಿಕ್ಲಿ, ಆ್ಯಂಡ್ ಇಟ್ ಆಲ್ಸೋ ಹ್ಯಾಪನ್ಸ್ ಮಿರಾಕ್ಯುಲಸ್ಲಿ, ವಿಚ್ ವಿ ಡೋಂಟ್ ಇವನ್ ರಿಯಲೈಸ್. ದ ಫೀಟಸ್ ಹ್ಯಾಸ್ ಟು ಮೇಕ್ ದಿಸ್ ಟು neonatal transition so quickly. We fail to realize that the baby can have troubles during this period. All right. So ಈ ಟ್ರಾನ್ಸಿಷನ್ ಆಗಲಿಕ್ಕೆ ನಾರ್ಮಲಿ ಫ್ಯೂ ಅವರ್ಸ್ ಟು ಫ್ಯೂ ಡೇಸ್, ಅಂದರೆ ಅಪ್ ಟು 72 hours ಆಗುತ್ತೆ. ಈ ಟೈಮಲ್ಲಿ ಕೆಲವೊಂದು ತೊಂದರೆ ಆಗೋ ಚಾನ್ಸಸ್ ಇರುತ್ತೆ ಮಕ್ಕಳಿಗೆ, ಎಲ್ಲ ಮಕ್ಕಳಿಗಲ್ಲ. ಫ್ಯೂ ಬೇಬೀಸ್ ವಿಲ್ ಫೇಲ್ ಟು ಟ್ರಾನ್ಸಿಷನ್ ಆರ್ ದೇ ವಿಲ್ ಹ್ಯಾವ್ ಡಿಲೇಡ್ ಟ್ರಾನ್ಸಿಷನ್. ಈ ಥರ ಪ್ರಾಬ್ಲಮಲ್ಲಿ ಲಂಗ್ಸ್ ಪ್ರಾಬ್ಲಮ್, ಬಿಕಾಸ್ ದ ಲಂಗ್ಸ್ ಆರ್ ಸ್ಟಿಲ್ ನಾಟ್ ವರ್ಕಿಂಗ್ ಇನ್ಸೈಡ್, ದೇ ಹ್ಯಾವ್ ಟು ವರ್ಕ್. ಸೊ ಆಕ್ಸಿಜನ್ ಲೆವೆಲ್ಸ್ ಕಮ್ಮಿ ಆಗೋದು. ಶುಗರ್ ಲೆವೆಲ್ಸ್, ಬಿಕಾಸ್ ಯು ಆರ್ ಕಟ್ಟಿಂಗ್ ದ ಅಂಬಿಲಿಕಲ್ ಕಾರ್ಡ್ ಫ್ರಮ್ ದ ಮದರ್, ಶುಗರ್ ಲೆವೆಲ್ಸ್ ಕಮ್ಮಿ ಆಗೋದು. They are coming from a cold environment to a very warm, from a warm environment to a very cold environment. So temperature ಕಮ್ಮಿ ಆಗೋದು are very 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 common. So understanding that there can be problems. So suddenly ಮಗು ಅಳುತ್ತೆ, doctor will come and tell you that baby cried and stable, however his oxygen levels are not normal. He needs to be in ICU for few hours. So for all the parents, please don't get offended or please don't get angry. It's a natural process. ಇದು ತಾತ್ಕಾಲಿಕವಾದ ಶ್ವಾಸಕೋಶದ ತೊಂದರೆ ಅಂತ ಹೇಳ್ತೀವಿ, ಟ್ರಾನ್ಸಿಯಂಟ್ ಟ್ಯಾಕಿಪ್ನಿಯಾ. It will take only few hours, sometimes up to 1 or 2 days. So just have some patience and trust in the doctor, so that because these are the transition which is happening and it is under nobody's control, and every baby has different transition period. So some babies do not need transition time at all. They are quickly cried and then go to the mother's side. Some babies will take 1 day, some baby will take 2 days, some baby will take 3 days. So it depends on baby to baby. So low sugar, low temperature, low oxygen levels are common immediately after the birth, and this is what we intend to prevent it by maintaining warmth, starting breastfeeding initially to maintain the blood sugars. So these are the transition problems, and every parent should know about it, and good that you raised this question.
So parents should not worry if the baby is in NICU for first 48 hours or something.
Most of the times they should not be worried. However, some babies do actually have a problem in the heart or lungs. They will not have complete transition at all. So in those cases, definitely the baby needs to be in the ICU, get investigated for why it is, and those are usually 1% of the population. Yeah, the transient tachypnea of newborn, which we call it as ತಾತ್ಕಾಲಿಕ ಶ್ವಾಸಕೋಶದ ತೊಂದರೆ, ಅದು ನಾರ್ಮಲ್ ಡೆಲಿವರಿಗಿಂತ C-section ಆಗಿರೋ ಮಕ್ಕಳಿಗೆ ಜಾಸ್ತಿ ಇರುತ್ತೆ. At least 3 to 6 times more in babies who are born out of C-section than normal deliveries. So in that, the parents should expect if the baby is born that these problems have more tendency in these babies. So, and this is all temporary. That's why it's called transient. ತಾತ್ಕಾಲಿಕವಾದ
So
ತೊಂದರೆಗಳು.
this period is very crucial.
Very crucial. That's the reason we make sure that the baby is stable before the baby goes to the mother's side. So that means we check the oxygen levels, we check the blood sugar levels, we examine the baby. If the baby is pink, the oxygen levels are good, baby is active, alert, reflexes are normal, oxygen levels ಚೆನ್ನಾಗಿದೆ ಅಂತಂದರೆ ಮಾತ್ರ we give the baby to the mother side for feeding and stuff. So that is what we do in the initial first few minutes of life.
ಓಕೆ. ಸೊ ಇವಾಗ ಹಾಸ್ಪಿಟಲ್ ಸ್ಟೇ ಅಂತ ಏನು ಹೇಳುತ್ತೆ, ಫಾರ್ ನಾರ್ಮಲ್ ಡೆಲಿವರಿ ಆಗಲಿ C-section ಆಗಲಿ ಒಂದು 4 to 5 days C-section ಆದರೆ, ಸೊ ಆ ಹಾಸ್ಪಿಟಲ್ ಸ್ಟೇ ಮುಗಿಸಿ ಡಿಸ್ಚಾರ್ಜ್ ತೊಗೊಂಡು ಮನೆಗೆ ಹೋಗುವಾಗ ಬೋಧ ಪೇರೆಂಟ್ಸ್ ಏನು ಗೊತ್ತಿರಬೇಕು, ವಾಟ್ ದೇ ಶುಡ್ ಚೆಕ್ ಫಾರ್, ಇದು ಆಗಿದೆಯಾ ನನ್ನ ಮಗುಗಾಗಿದೆಯಾ, ಆರ್ ಇದು ವಾಟ್ ಶುಡ್ ಐ ಹ್ಯಾವ್ ಟು ಡೂ ಆಫ್ಟರ್ ದ ಡೆಲಿವರಿ ಅನ್ನೋದು ಅವ್ರಿಗೊಂದು ಪ್ರೋಟೋಕಾಲ್ ಎಲ್ಲ ಅವ್ರಿಗೆ ಗೊತ್ತಿರಬೇಕು. ಸೊ ಅದ್ರ ಬಗ್ಗೆ ಹೇಳೋದಾದರೆ ಸರ್.
See, there I'll talk only to the neonatal part, andre baby ಬಗ್ಗೆ ಮಾತ್ರ ಹೇಳೋದು. Mothers, they can be the problem, so I'm not an expert on OBG gynec side. So I'll talk only on the baby side, what the parents should have bare minimum things for their baby before they going home. First is the weight check. So before getting discharged, the baby should have a weight check. Andre ಈ ಮಗು 2.5 kg ಇದ್ರೆ the baby may lose weight, but that is up to 10%. ಅಂದರೆ 10% weight 3 kg ಇದ್ದರೆ 300 grams the baby can lose in the first 5 to 7 days of life. So weight check ಆಗೋದು very very important. If the weight loss is more than 10%, then baby should not be discharged, or mother needs some support for feeding, ಅಂದರೆ lactation support. So first is weight check. Second is the jaundice. It is so very important. Physiological jaundice ಅಂತ ಹೇಳ್ತೀವಿ. ಅಂದರೆ ನಾರ್ಮಲಿ 24 to 48 hours ಆದಮೇಲೆ we do a jaundice check for the baby, for all babies. It's a mandatory thing to be done before discharge. ಇದು ಒಂದು ಲೆವೆಲ್ಗಿಂತ ಜಾಸ್ತಿ ಇದ್ದರೆ there is a treatment called phototherapy for that. Okay, based on the risk factors, we consider that as whether the treatment is required or not. Third is hearing test. ಇದು ಕಿವಿಗೆ, whether the baby is able to hear, that means the neurons are working from ear to the brain. This test. Fourth is newborn screening test, ನವಜಾತ ಶಿಶು ಪರೀಕ್ಷೆ. ಇದರಲ್ಲಿ ಕೆಲವೊಂದು ಥೈರಾಯ್ಡು, ಆನುವಂಶಿಕ ತೊಂದರೆಗಳು ಇಲ್ಲ ಜನ್ಮಜಾತ ತೊಂದರೆಗಳು, ಇನ್ಹೆರಿಟೆಡ್ ಪ್ರಾಬ್ಲಮ್ಸ್ ಆರ್ ಮೆಟಾಬಾಲಿಕ್ ಪ್ರಾಬ್ಲಮ್ಸ್ ಪತ್ತೆ ಮಾಡಲಿಕ್ಕೆ we do this. So these are the bare minimum test the baby should have, and the weight check before discharge. In terms of medicines, the baby should have a vitamin D, which is required for the baby before discharge. So that's the only medically advised thing apart from the breast milk to the baby before discharge.
ಓಕೆ ವ್ಯಾಕ್ಸಿನೇಷನ್ಸ್ ಅನ್ಬರೋ ಹೋದರೆ ಯಾವುದು ಇಂಪಾರ್ಟೆಂಟ್ ಯಾವುದು ಆಗಿರಬೇಕು?
So these are usually given immediately after birth, or within first 48 hours. As I say, before discharge you can add this thing, is vaccination. Adರಲ್ಲಿ more important one is BCG, which is for tuberculosis, given in the arm, one in the leg, which is hepatitis B, and third is polio, 2 drops of polio before discharge. So these are the 3 minimum vaccines, and mandatory rather than minimum, it's a mandatory vaccine to be given to any baby after delivery anywhere across India. So ಯಾವುದೇ setup alagli, it could be private, public, it could be even in the village level. These are the 3 vaccines which needs to be given as a part of protocol.
ಹೋದ್ರೆ ಇಸ್ ಇಟ್ ಕಂಪಲ್ಸರಿ ಸರ್ ಟು ಗಿವ್ ಇಟ್ ಟು ಎವ್ರಿ ಬೇಬಿ?
Yes, see, the recommendation is to give for every baby up to 1 year of life. Okay, if you do the evidence based, up to 4 to 6 months ಕೊಟ್ರು ಪರವಾಗಿಲ್ಲ. But ideally WHO recommendation is we give up to 1 year of life every baby 400 international units anta, that is the normal required dietary allowance of the baby. ಯಾಕೆ ಕೊಡಬೇಕು ಅಂದರೆ ಬ್ರೆಸ್ಟ್ ಮಿಲ್ಕಲ್ಲಿ ದ ವಿಟಮಿನ್ ಡಿ ಲೆವೆಲ್ಸ್ are lesser to meet the nutritional requirements of the baby. So if you are only feeding breast milk, the nutritional requirements are of vitamin D are not met. There are other things also which are slightly less in breast milk, which is vitamin K. But vitamin K birth alli now immediate all babies who are born at birth within first 5 minutes alli vitamin K injection ಕೊಟ್ಬಿಡ್ತೀವಿ. So that is one thing which is given. And for premature babies algi iron ಅಂತ ಹೇಳ್ತೀವಿ. So which is ಕಬ್ಬಿನಾಂಶ ಕಮ್ಮಿ ಇರುತ್ತೆ ಬ್ರೆಸ್ಟ್ ಮಿಲ್ಕಲ್ಲಿ. ಕಮ್ಮಿ ಇದ್ರೂ ಅದರದ್ದು ಕ್ವಾಲಿಟಿ superior ಆಗಿರುತ್ತೆ. The bio availability is much superior, but the quantity is less. So that is why premature babies ಅಲ್ಲಿ or babies at 6 months, 4 to 6 months range ಅಲ್ಲಿ ಐರನ್ ಥೆರಪಿ ಅಂತ ಶುರು ಮಾಡ್ತೀವಿ ಎಲ್ಲ ಮಕ್ಕಳಿಗೂ. So these are the 3 most common things. Vitamin K is an injection given at birth. Vitamin D should be given up to 1 year of life, and iron.
ಓಕೆ ಸರ್, ಒನ್ಸ್ ದ ಬೇಬಿ ಇಸ್ ಡಿಸ್ಚಾರ್ಜ್ಡ್ ಆ್ಯಂಡ್ ಗೋಸ್ ಹೋಮ್, ಮನೆಯಲ್ಲಿ ಎಲ್ಲ ರಿಲೇಟಿವ್ಸ್ ಇರ್ತಾರೆ, ಅಜ್ಜಿ ಅಕ್ಕಪಕ್ಕದ ಮನೆಯವರು ಎಲ್ಲರೂ ಇರ್ತಾರೆ. ಸೊ ದೇ ಯೂಶ್ವಲಿ ಸೇ ಮಗುನ ಬಿಸಿಲಿಗೆ ಎತ್ಕೊಂಡು ಹೋಗು, ಮಗುನ ಬಿಸಿಲಿಗೆ ಎಕ್ಸ್ಪೋಜರ್ ಮಾಡು. ಸೊ ಬಿಸಿಲಿಗೆ ಎಕ್ಸ್ಪೋಜರ್ ಮಾಡೋದ್ರಿಂದ ವಿಟಮಿನ್ ಡಿ ಬರುತ್ತಾ? ಇಸ್ ಇಟ್ ಹಾರ್ಮ್ಫುಲ್ ಆರ್ ಡಸ್ ಇಟ್ ಹೆಲ್ಪ್ ದ ಬೇಬಿ?
ಸಿ, ಬಿಸಿಲಿಗೆ ಎಕ್ಸ್ಪೋಸ್ ಮಾಡೋದು 2 reasons. One is for jaundice. The common conception is it will reduce the jaundice, and second is vitamin D. Obviously these are the 2 benefits. Sunlight has a spectrum. Okay, ಅದರಲ್ಲಿ ಕೆಲವೊಂದು harmful radiations ಇದೆ, ಕೆಲವೊಂದು beneficial radiations ಇದೆ. You can't filter out those radiations. Okay, ಅದರಲ್ಲಿ UV ultraviolet radiations are harmful for the baby on the baby skin, and ಅದರಲ್ಲಿ blue lights, visible light is the one which is responsible for helping in jaundice. That means it converts the jaundice and excrete them in the urine and stools. So ನೀವು ಡೈರೆಕ್ಟ್ ಸನ್ಲೈಟ್ ಕೊಡೋದು ಎರಡು ಬೆನಿಫಿಷಿಯಲ್ ಎಫೆಕ್ಟ್ಸ್ ಜಾಂಡಿಸ್ಗೆ. ಜಾಂಡಿಸಲ್ಲಿ ಇಟ್ ವಿಲ್ ನಾಟ್ ಹೆಲ್ಪ್ ಇನ್ ಸಿವಿಯರ್ ಆರ್ ಮಾಡ್ರೇಟ್ ಜಾಂಡಿಸ್. ಮೈಲ್ಡ್ ಜಾಂಡಿಸಲ್ಲಿ ಹೆಲ್ಪ್ಫುಲ್ ಇದೆ, ಪ್ರೊವೈಡೆಡ್ ಯು ಫಿಲ್ಟರ್ ಔಟ್ ದಿ ಅಲ್ಟ್ರಾವೈಲೆಂಟ್ ರೇಡಿಯೇಷನ್ಸ್. ಹೌ ಡು ಯು ಫಿಲ್ಟರ್ ಔಟ್ ಎಟ್ ಹೋಮ್? ಯು ಡೋಂಟ್ ಹ್ಯಾವ್ ಎನಿಥಿಂಗ್ ಎಟ್ ಹೋಮ್.
So sunscreen is also not recommended for the baby?
Absolutely no. So you can't filter out a sun ray to escape the ultraviolet radiations, correct? What are the downsides of it, of exposing sunlight unmonitored? First is it can cause sunburns if the baby, because baby skin is very sensitive and it's still evolving up to 1 month of life. It can cause hyperthermia, andre expose madidre the temperature goes up in the body because they are so labile in their temperatures. Hypothermia, cold wind ಆಗ್ತಾ ಇರುತ್ತೆ, ಸನ್ಲೈಟ್ ಇರುತ್ತೆ, ಬಟ್ there is a cold breeze which is going over the baby's skin.
Yes.
So that will cause the temperature to drop down, and then dehydration, especially where the sunlight is too high in intensity. ಆವಾಗ risk of dehydrations are so many. In summers ಅಲ್ಲಿ we see Many babies coming with severe dehydration and may even lose life. Okay, unnecessary, unwarranted, unmonitored exposure of sunlight. So if you are giving sunlight, it has to be very mild inside the home, through a window, and just briefly. And that
Somewhere around in the morning.
morning hours, mid morning. And this is again not evidence based. Evidence says don't give sunlight because it won't help in any jaundice which is moderate or severe.
Okay.
The studies are only for mild jaundice. Vitamin D, we are already supplementing the baby with vitamin D, and that is in the what the exposure is for the pediatric age group. ಅಂದರೆ 1 ವರ್ಷ ಆದಮೇಲೆ ಮಿಡ್ ಮಾರ್ನಿಂಗ್ 10ರಿಂದ 2 ಗಂಟೆಗೆ ಎಕ್ಸ್ಪೋಸ್ ಮಾಡಿದ್ರೆ ವಿಟಮಿನ್ ಡಿ ಪ್ರೊಡ್ಯೂಸ್ ಆಗುತ್ತೆ. ದಟ್ಸ್ ಅ ಫ್ಯಾಕ್ಟ್ ಅಂಡ್ ಅನ್ ಎವಿಡೆನ್ಸ್. ಸೊ ಫಾರ್ ನ್ಯೂಬಾರ್ನ್ ಬೇಬೀಸ್ exposing sunlight, although there may be beneficial effects, I'm not telling no, maybe we will have more studies in the future, but currently it's no, because the safety data is not known.
ಡೈರೆಕ್ಟ್ ಎಕ್ಸ್ಪೋಜರ್ ಬೇಡ, ಬೇಕಾದ್ರೆ ಮನೆ ಒಳಗೆ
Correct.
ಬಾಲ್ಕನಿಯಲ್ಲಿ ವಿಂಡೋಸ್ ಅಲ್ಲಿ you can
Yes,
have
and
that
it has to
exposure.
be carefully monitored briefly, be provided the baby is not too cold, not too hot, not too small babies should not be exposed to the air at all, okay, because they will have high risk of hypothermia. So this things, it comes with caveat, so that has to be monitored, and most of the parents do not know this, and especially the ಮಾಡೋದು ಹಳ್ಳಿಗಳಲ್ಲಿ, that is where because they do not know the side effects. It's again ignorance, it's not their fault. So we need to inform that, they give them the right information.
And we have to educate them
Of
about
course,
this.
that's the ultimate.
ಇನ್ನೊಂದು ಸರ್, ಮಗು ಮನೆಗೆ ಬರ್ತಾ ಇದೆ ಅಂತ ಇದ್ದಂಗೆ ಸಂಭ್ರಮ.
Hmm.
Everybody are happy and all the concentration is on the baby. I'm not telling maguna ತಾಯಿನ ಇಗ್ನೋರ್ ಮಾಡ್ತಾರೆ ಅಂತ, but the concentration is little lesser for the mother, and she's already going through a lot of things, emotionally, physically, hormonal changes from pregnancy, delivery, post delivery, that postpartum period ಅನ್ನೋದೇ ಒಂಥರ she's already into depression. ಸೊ ಈ ಪೀರಿಯಡ್ ಅಲ್ಲಿ ಫ್ಯಾಮಿಲಿ ಆಗಲಿ ಹಸ್ಬೆಂಡ್ ಆಗಲಿ ಹೆಂಗೆ ಹೆಲ್ಪ್ ಮಾಡ್ಬೋದು?
So see, as soon as the mother comes to the home, the first thing what she usually gets exposed to is getting many relatives and to see the baby, which is out of love and curiosity. All right, so first is reduce the chances of infection by unnecessary exposure to mother and the baby. Second is because her hormonal surges were so high during delivery and they have to come back to normal. This will not only affect her physical status but immensely on her mental status as well. So ತಾಯಿ ಮೆದುಳಿನ ಮೇಲೆ ಎಷ್ಟು ಇಂಪ್ಯಾಕ್ಟ್ ಆಗಿರುತ್ತೋ it is very immense. So her stress levels are so immense. As I told you, the stress levels during delivery are so, the pain she has undergone is so much, is to bring back those adrenaline levels, her stress levels to normal. It will take her time. During that time, the bare minimum the husband or the family can do is give her emotional support, is because she has not undergone any disease. It's a natural process. However, there are a lot of physical changes, mental changes in her. So to bring that back to normal, she needs the physical support, obviously, but also most importantly is the mental support and emotional support on taking care of the baby and her diet and her medications, all these things. So these things should be clubbed together to help her.
ಸೊ ಈ ಪೋಸ್ಟ್ ಪಾರ್ಟಮ್ ಡಿಪ್ರೆಷನ್ನ ಅವಾಯ್ಡ್ ಮಾಡೋಕ್ಕೆ ಡು ಯು ಅಗ್ರಿ ದಟ್ ಶಿ ಶುಡ್ ಬಿ ಪ್ರಿಪೇರ್ಡ್ ಫ್ರಮ್ ದ ಟೈಮ್ ಶಿ ಇಸ್ ಬೀನ್ ಪ್ರೆಗ್ನೆಂಟ್ ಅಂತ ಗೊತ್ತಾಗಿದ ತಕ್ಷಣದಿಂದ ಇಫ್ ಶಿ ಇಸ್ ಕೆಪ್ಟ್ ಹರ್ ಮೆಂಟಲ್ ಸ್ಟೇಟಸ್ stable, if she is doing yoga, meditation, these all will help her?
Definitely, these are the things. And firstly is whether if she has had any previous experiences, she should discuss with her obstetrician beforehand, and the obstetrician will know that she is prone to have postpartum depression. So avaga these kind of therapies, more emotional support, what the apart from the obstetrician, the family, especially the husband, should give her more emotional support. And if she's first time mother, and if she's worried about, she is already prone, there are certain risk factors which tells that she is prone to have postpartum depressions. Avaga informing your obstetrician, taking appropriate guidance from her, and as you told, yoga, meditations, all right. So there are no proper medications to treat that. It is the emotional that drives her into postpartum depression. So that is very important, and the emotional support and the mental support what she needs and requires is immense, and that only comes from the family.
Do you agree with the fact that mother healthy mentally, the baby is healthy?
Yeah, it's a no-brainer. If the mother is very stable, very healthy in physically or mentally, she'll be able to feed her baby properly and take care of her baby. The only thing the mother will be worried immediately after delivery is how to take care of her baby. Okay, the rest is secondary to her, provided she's mentally ill, like if she's postpartum depression or she has any other concerns. Otherwise, the predominant or the only thing she will have is to take care of the baby, and if she fails to do so, she will be the most unhappiest person. Yeah. So that is what drives her daily routines is I should take care of the baby, and if she's emotionally well, physically well, and if she feels that her actions are giving the results, like baby is very active, playful, gaining weight, doing well, that is again a consistent vicious cycle which push her to do much better. So I think that's a straightforward, everyone should understand. I think they know it.
Yeah. And ಇವಾಗ ಯೂಶಲಿ what they do, ಮಗು ಮನೆಗೆ ಬಂದಾದ್ಮೇಲೆ ಬೇದಿಂಗ್ has become like one ritual, ಲೈಕ್ ಮಸಾಜಸ್ ಮಾಡೋದು, ಬೇಬಿ ಪ್ಯಾಕ್ಸ್ ಹಾಕೋದು. ಬಿಕಾಸ್ ಬೇಬಿ ಹಾಸ್ಪಿಟಲಲ್ಲಿದ್ದಾಗ ಕೆಂಪಗಿತ್ತು, ಪಿಂಕ್ ಕಲರ್ ಇತ್ತು, ಮನೆಗೆ ಬಂದಿದ ತಕ್ಷಣ ಕಲರ್ ಫೇಡ್ ಆಗ್ತಾ ಇದೆ. ಸೊ ದೇ ಟೇಕ್ ಸಮ್ ಬೇಸನ್ ಆಗಲಿ ಮಸೂರ್ ದಾಲ್ ಆಗಲಿ ಹಾಕಿ ಚೆನ್ನಾಗಿ ತಿಕ್ತಾರೆ ಅಂಟಿಲ್ ದ ಸ್ಕಿನ್ ಕಮ್ಸ್ ಔಟ್, ಇಫ್ ಐ ಆಮ್ ನಾಟ್ ರಾಂಗ್. ಆಯಿಲ್ನ ಬಿಸಿ ಮಾಡಿ ಮೂಗೊಳಗಡೆ ಕಿವಿ ಒಳಗಡೆ ಹಾಕೋದು, ಹೊಕ್ಕಳ ಮೇಲೆ ಹಾಕೋದು, ಸೊ ದಟ್ ಹೀಟ್ ಹೋಗುತ್ತೆ ಅಂತ. ಸೊ ಅಬೌಟ್ ದೀಸ್ ಪ್ರೊಸೀಜರ್ಸ್ ವಾಟ್ ಡು ಯು ಸೇ ಸರ್?
With regards to oil massage, uh, you can do as gentle oil massage provided it's gentle, I would say in that way. Okay, you do an oil massage provided it's gentle, using a simple, cheap, cost effective coconut oil. And this oil should not be put in the ears, nose, all right, and preferably done by a home person. Okay, the dyes or the trainer who comes and does it, they are not trained to do, of course they have experience in doing that, but there are certain things which can cause harm in the baby. So many times we see that the hands are stretched, the ears are stretched so much so that the baby screams. I mean, it's again a myth and a misconception that if you do daily, the nose massage don't become straight. If you do the ear will open up on the eyes, on the hands, on the belly button. So, and the color also of the baby, if you do oil massage, the color will not change. It's a genetic one. All right, nose, everything is genetically made. You can't change just with oil massage or anything. So it is to stimulate the sensory pathways of the baby. So you do oil massage is to stimulate the sensory pathways, andre mele ಏನು ನರಗಳಿರುತ್ತೆ, gentle oil massage ಇಂದ it
To soothe the
stimulates to the
baby.
brain, and it will have a soothing effect on the baby as well. So ಇದು ಮಾಡೋದು, it is gentle only. If you go to an extreme, it will harm the baby. It can have fractures, it can cause pain to the baby. If you do most of the times, very few cases, all pediatricians must have encountered on the fractures after bathing. Okay, especially smaller babies like who is 2 kilo 2.5 kilos ke ಸ್ವಲ್ಪ jug bitre, then they will have fractures, and one or two instances we must have come across, any pediatrician for that matter. Okay, so doing oil massage is all right, gentle massage, there is no evidence for it, but it's all right to do a gentle oil massage using a coconut oil. Regards to bathing, just normal warm water is absolutely fine. If you are using soap, visibly andre dirty agide, like stools magu mega agide, urine pass madide, then of course, and daily bathing is absolutely fine. All right, so using a soap it's also not recommended scientifically, but absolutely fine to use a soap.
And one more practice which I've seen, I don't know how to call it, sir. Baby chest in the milk ತೆಗೆಯೋದು, so that it won't affect the baby at the time of puberty. This process causes so much of pain to the baby, as well as it causes so much of infections. I am sure you would have come across such cases. So what do you tell about this, sir?
Definitely, it's a very painful process, and it's very wrong for, because baby is not saying you something, you're doing something which it's which is against the natural process. Why the smell comes is the mother has high amount of hormones, as I told you. It crosses to the baby naturally, even if male baby or female baby. So that maternal hormones will produce milk in the baby. It could be male or female, doesn't matter. It's gender neutral. So both we can have this milk production. and if the maternal hormonal levels in the baby's blood are high, and this will clear as the days progresses. Pulling out the milk every day, squeezing it makes it more worse. So ದಯವಿಟ್ಟು ಈ procedure, it's very wrong. Don't do it. It will only complicate the things, because if you start squeezing, that will act as a stimulus. It will produces more milk, and that will form an abscess. Sometimes we may end up operating those. That is incision ಮಾಡಿ ತೆಗಿಬೇಕಾಗುತ್ತೆ ಪಸ್ಸು or whatever has formed. So you are only traumatizing the baby by doing these procedures. So definitely ಸ್ನಾನ ಮಾಡಿಸುವಾಗ, especially it is done during bathing.
Massaging and bathing.
Correct. ಆ ಟೈಮಲ್ಲಿ they try to squeeze and take out the milk, which is absolutely wrong. So kindly requesting not to do this.
It won't affect anything after puberty.
It's not related, because these hormones are maternal and they will get destroyed in few days or eliminated from the body in few days or few weeks. So wait for it, have patience, and don't trouble the baby.
ಸೊ ಇನ್ನೊಂದು ಬ್ರೆಸ್ಟ್ ಫೀಡಿಂಗ್ ಅಂತ ಬಂದರೆ ಯೂಶಲಿ ಡಿಸ್ಚಾರ್ಜ್ ಆಗೋ ಟೈಮಲ್ಲಿ ದ ಮದರ್ ವುಡ್ ಬಿ ಅವ್ರಿಗೆ ಹೇಳಿರ್ತಾರೆ, ದ ನರ್ಸಿಂಗ್ ಸ್ಟಾಫ್ ಆರ್ ಡಾಕ್ಟರ್ಸ್ ವುಡ್ ಹ್ಯಾವ್ ಟೋಲ್ಡರ್ ಎವ್ರಿ 2 hours ಫೀಡ್ ಮಾಡಬೇಕು ಅಂತ. ಸೊ ಸಮ್ ನ್ಯೂ ಮಾರ್ನ್ಸ್ ಫಸ್ಟ್ ಟೈಮ್ ಏನು ಬರ್ತ್ ಮಾಡಿ ಕೊಟ್ಟಿರ್ತಾರೆ, ದೆಲ್ ಬಿ ಸೋ ಕಾನ್ಷಿಯಸ್, ಎವ್ರಿ 2 hours ಟೈಮಲ್ಲಿ ಇಟ್ಕೊಂಡಿರ್ತಾರೆ, 2 hours ಫೀಡ್ ಮಾಡ್ಬೇಕು ನಾನು.
Yes.
ಈವನ್ ದ ಬೇಬಿ ಇಫ್ ಇಟ್ಸ್ ಸ್ಲೀಪ್, ನೈಟಲ್ಲಿ ಮಲಗಿದ್ರು, ದೇ ಆರ್ ಬ್ಲೆಸ್ಡ್ ಟು ಹ್ಯಾವ್ ಸಚ್ ಬೇಬೀಸ್ ಟು ಹೂ ಸ್ಲೀಪ್ ಅಟ್ ನೈಟ್. ಸೊ ಮಲಗಿದ್ರು ಅದನ್ನ ಪಿಂಚ್ ಮಾಡೋದು, ಏಳ್ಸೋದು, ಅದು ಕ್ರ್ಯಾಂಕಿ ಆಗಿದ್ರು ಕೂಡ ಹಾಲು ಕುಡ್ಸೋಕ್ಕೆ ಟ್ರೈ ಮಾಡೋದು, ದೆನ್ ದ ಬೇಬಿ ಜಸ್ಟ್ ವಾಮಿಟ್ಸ್. ಸೊ ಈ ಥರ ಮಾಡುವಾಗ ಇಸ್ ಇಟ್ ನೆಸೆಸರಿ ಟು ವೇಕ್ ಅಪ್ ದ ಬೇಬಿ ಅಂಡ್ ಫೀಡ್?
See, normally any baby will sleep about 16 to 18 hours. That's a normal sleep cycle. Okay, and they do not have something called circadian rhythm ಇರಲ್ಲ ಅವರಿಗೆ. Circadian rhythm means when the sun rises, we will know that there is a daytime and we are awakened. There is a hormone, it depends on the melatonin hormones. When the sun sets, we know that it's dark and we go to sleep. That is not developed in the babies, and it will take some time. All right, it could be 3 to 6 months. So baby sleeps most of the time. All right, any feeding, if you are waking up every day, that cycle will be disturbed. You ask 2 hourly feeding if the baby is premature, ಅಂದರೆ 34 ವೀಕ್ಸ್ಗಿಂತ ಕಮ್ಮಿ ಇದ್ದರೆ, ಬಿಕಾಸ್ ವಿ ಡೋಂಟ್ ವಾಂಟ್ ಲಾಂಗರ್ ಡ್ಯೂರೇಷನ್ ಟು ಪ್ರಿವೆಂಟ್ ಹೈಪೋಗ್ಲೈಸಿಮಿ ಇನ್ ದ ಬೇಬಿ. ಅಂದರೆ ಲೋ ಶುಗರ್ ಆಗುತ್ತೆ ಇಫ್ ಯು ವೇಟ್ ಫಾರ್ ಅ ಲಾಂಗರ್ ಇನ್ ಅ ಬೇಬಿ, ಬಿಕಾಸ್ ಸ್ಮಾಲರ್ ಬೇಬೀಸ್ ಆರ್ ನಾಟ್ ಏಬಲ್ ಟು ಜನರೇಟ್ ದೇರ್ ಓನ್ ಗ್ಲೂಕೋಸ್. ಬಿಗ್ಗರ್ ಬೇಬೀಸಲ್ಲಿ ನಾರ್ಮಲ್ ಫೀಡಿಂಗ್ ಈಸ್ 3 to 4 hourly ಆರ್ ಡಿಮಾಂಡ್ ಫೀಡಿಂಗ್. ಅಂದರೆ ಮಗು ವಿಲ್ automatically tell you, the baby will automatically will tell that I'm hungry, he will get awake. However, if the duration goes 5 to 6 hours, then we tend ask the parents is you wake them with gentle tapping, not pinching or squeezing or anything. All right, so but most of them have that demand feeding sleep wake cycle. So 3 to 4 hourly they feed, they sleep, they feed. So to know, I think I can tell you about that. Most of the mothers are mainly worried that the milk is not enough. Is that right?
Yes.
Yeah, so that's the most common thing they tell you. The adequacy of milk production will be known if the baby is sleeping after feed. If the baby is passing urines adequately, that means about 5 to 6 times a day. And if the baby is gaining weight. So how do you know gain weight? When you go to the next checkup, the doctor will check the weight. So baby feeding is fine. I mean, sleeping after the feed for 2 to 3 hours. Baby is passing urine and baby is gaining weight. This indicates adequacy. Any mother who is breastfeeding should not be worried that the milk is not enough.
Yes, sir. That's what I was about to tell you, sir. There's one set of women or mothers who don't feed at all. Magu suck martilla. I'm not able to lactate properly.
Yeah.
So let the baby sleep. So this is not only harming the baby, it's harming her itself.
Correct.
So ಇದ್ರ ಬಗ್ಗೆ ಹೇಳೋದಾದ್ರೆ sir.
There are two things here. One is the impact that the mother will have if she thinks that she's not feeding her baby properly. So that will act as a negative mechanism on her milk production. So any negative feelings for that matter will impact the production of the milk very drastically. So there are no medications which are proven to enhance the milk production. Her stress levels have to come down. She should have a positive psyche, thinking that I'm getting enough milk. If you deliver a baby, naturally you will produce enough milk for your baby. All right, there's a natural way, provided there are certain factors which will hinder this. ಅಂದರೆ ನೆಗೆಟಿವ್ thinking that stress levels, mother is sick, she's in pain, all this will reduce her milk production. So that is one aspect of it. Second is, if she's not feeding the baby for a longer time. Normally ನಾನು ಹೇಳಿದ್ದು ಡಿಮಾಂಡ್ ಫೀಡಿಂಗ್ ಅಂತ. ಸೊ ಎವ್ರಿ 3 to 4 hourly the babies usually wake up, unless they are bigger enough. They are ಸ್ವಲ್ಪ they go older, like 3 to 6 months, they awake, they may awake after 4 to 5 hours or 6 hours. Initial 1 month ಅಲ್ಲಿ, if the babies are sleeping longer, sometimes we assume that the babies are sleeping. Actually ಏನಾಗ್ತಾ ಇರುತ್ತೆ, the blood sugar has gone down, all right, and once the blood sugar goes down, the brain will not get the glucose. Normally, you and me, we have an alternative mechanism to produce something called ketones. So we will not be hypoglycemic. We will have little dullness, but we won't have fits, seizures ಬರಲ್ಲ ನಮಗೆ. ಮಕ್ಕಳಲ್ಲಿ ಏನಾಗುತ್ತೆ, they won't have, they have, but it's not activated to produce ketones. Immediately, it will take some time. So our time ಅಲ್ಲಿ the amount of glucose which should go to the brain will not go, and they will manifest in the form of seizures, ಅಂದರೆ ಫಿಟ್ಸ್ ಅಂತ ಹೇಳ್ತೀವಿ, ಅದು ಬರುತ್ತೆ. Once it comes, that's the most dangerous thing the baby can have, because it will leave not only a short term effect like being in ICU or having fits, but also long term, because these babies can have future complications like vision problems, walking problems ಆಗುತ್ತೆ. So all can be avoided just taking care of the feeding at appropriate times, which is 3 to 4 hour period, not less, not more. The baby is not awake. You always look at the activity of the baby. Baby ಮಲಗಿದೆ ಬಟ್ ವೆರಿ ಆಕ್ಟಿವ್ ಅಂತಂದರೆ ಅನ್ಲೈಕ್ಲಿ that the baby will have hypoglycemia, ಅಂದರೆ low sugars in the blood. The baby is very dull, not active, not feeding, not awake, not opening the eyes. There is some concern. Most likely concern would be ಲೋ ಬ್ಲಡ್ ಶುಗರ್ಸ್ ಆರ್ ಇನ್ಫೆಕ್ಷನ್. ಸೋಂಕು ಇದ್ದರೆ ಮಾತ್ರ ಈ ಥರ ಆಗುತ್ತೆ, ಇಲ್ಲಾಂತಂದರೆ ಲೋ ಬ್ಲಡ್ ಶುಗರಿಂದ ಆಗುತ್ತೆ. ಆ್ಯಂಡ್ ದೀಸ್ ಟೂ ಆರ್ ದ ಮೋಸ್ಟ್ ಕಾಮನ್ ಪ್ರಿವೆಂಟೇಬಲ್ ಕಾಸ್ ಆಫ್ ಡೆತ್ ಇನ್ ದ ಬೇಬೀಸ್. ದಟ್ ಮೀನ್ಸ್ ವಿ ಕ್ಯಾನ್ ಈಸಿಲಿ ಪ್ರಿವೆಂಟ್ ದಿಸ್. ಆ್ಯಂಡ್ ದೀಸ್ ಆರ್ ಟಾಪ್ 5 ಕಾಸಲ್ಲಿ ಬರುತ್ತೆ, ಸೋಂಕು ಮತ್ತು ಹೈಪೋಗ್ಲೈಸಿಮಿ.
ಇದು ಇನ್ನೊಂದು ಸರ್, ಇಫ್ ಶಿ ಇಸ್ ನಾಟ್ ಫೀಡಿಂಗ್ ದ ಬೇಬಿ ಪ್ರಾಪರ್ಲಿ, ಶಿ ವಿಲ್ ಆಲ್ಸೋ ಲ್ಯಾಂಡ್ ಅಪ್ ಇನ್ ಟು ಬ್ರೆಸ್ಟ್ ಕಂಜೆಷನ್. This might lead to cancerous conditions. So it's better to feed the baby in certain intervals.
Rather than saying it is better, it's the only way out.
Yeah.
And that baby is dependent on your feeding, all right? So if you don't feed the baby, some mothers produce excess milk, all right? So in that case, if the only way the milk will produce, provided the breast is empty, that will act as a stimulus to the brain, the hormones will produce, and then more milk will come. Once you have a full breast, that means the hormones won't be produced. That means the brain thinks that there is enough milk, I should not produce. If it is not emptied on time, even if the baby is sleeping, and if the mother feel that she is producing excess, she has to take that and discard or store it.
She has to extract it.
The more she extracts, the more milk will come, because brain is the one which produces hormones to produce the milk, and the brain should know what is happening with the milk. The milk is stagnant there, it's not going to produce enough milk. It will not send the hormones to produce enough milk. It's as simple logic as possible. Yes. If it is empty, then brain will produce more milk, because that's a natural way. It has to feed the baby. Brain knows that there is a baby.
Yeah.
All right. So the hormones have to come, and how it will come? Provided someone is giving that the stimulus. All right. So that comes when the breast is empty or full.
To conclude this, breastfeeding, if she's not milking enough, if she's not lactating enough, home remedies help ಆಗುತ್ತೆ. But more than that, her positive mindset is the only way.
Exactly. There is no evidence on home remedies agli. These are all supportive. Any tablet she takes, there are certain tablets which even doctors prescribes, which are absolutely fine, but the evidence to promote milk secretion is not there. The only way we can help secreting is getting an appropriate lactation help for her. If she's struggling, is to get some support on what is the appropriate position, appropriate latching technique, appropriate timing when she should feed. These are the things which will, and of course the mental support. Any medication, any therapy, any Ayurvedas or anything are not evidence based for increasing the breast milk. It will act as only as a supportive or a placebo. ಅಂದರೆ ಇಟ್ ವಿಲ್ ಗಿವ್ ಹರ್ ಪಾಸಿಟಿವ್ ಆಸ್ಪೆಕ್ಟ್ ದಟ್ ಇಟ್ ಈಸ್ ವರ್ಕಿಂಗ್, ಇಟ್ ಮೇ ವರ್ಕ್, ಬಟ್ ದೀಸ್ ಆರ್ ನಾಟ್ ಎವಿಡೆನ್ಸ್ಡ್ ಬೇಸ್ಡ್ ಮೆಡಿಕೇಶನ್ಸ್.
ಓಕೆ. ಸೊ ಯೂಶಲಿ ನೀವು ನೋಡಿರ್ತೀರ ಪ್ರಾಕ್ಟೀಸಲ್ಲಿ ದಟ್ ಮೈ ಬೇಬಿ ಈಸ್ ಪೂಪಿಂಗ್ ಅಲಾಟ್ ಆರ್ ಮೈ ಬೇಬಿ ಈಸ್ ನಾಟ್ ಪಾಸ್ಡ್ ಯೂರಿನ್ ಫಾರ್
True.
some 12 hours or my baby is not pooped for 4 to 5 days.
Correct.
So ಇದು ಎರಡು ನಾರ್ಮಲ್.
So poop passing stool output is one of the common things which we come across, and that is in the mental aspect of most of the grandmothers and mothers. Okay, because pooping is everything relates to the poop. Okay, when in the OPD practice what we see. Okay, baby cry ಆಗ್ತಾ ಇದೆ because poop ಮಾಡಿಲ್ಲ, baby silent ಇದೆ because poop ಮಾಡಿಲ್ಲ. Every time it is not related to the poop. Normally breast milk contains 75 to 80% of water that goes through the kidneys, and your baby has to pass urine every day 5 to 6 times. Stool output depends on the babies. Some babies pass 6 times, 8 times, 10 times, up to 15 times. Formed stools which are yellow, okay, slightly seedy or slightly pasty is absolutely normal. Even slightly greenish is absolutely fine.
ಓಕೆ. ರೆಡ್ ಸೈನ್ಸ್ ಅಂತ ನೋಡೋದಾದ್ರೆ
It let me complete this frequency. Most of the time, if the baby passes 10 to 15 times, is normal. The baby doesn't pass 4 to 5 days, it's normal.
ಬೋತ್ ಆರ್ ನಾರ್ಮಲ್, ಬೋತ್
Both are
ಎಕ್ಸ್ಟ್ರೀಮ್ಸ್
extremes are normal. So giving medications to make the baby poo is absolutely wrong. So all the parents, please don't do this. All right, baby has to pass urine. However, sometimes you have to be worried when these are the red flag signs, I would say. One, when the baby tummy is bigger, or if the baby is vomiting and has not passed poop for few days, because there is obstruction, it means there's some block in the pipe. Second, if the color of the stool is light yellow or it is completely white or gray in color, this indicates something very sinister in the liver. So these are dangerous, or blood in the stools. When these are there, you visit the doctor. Baby is passing formed stools 8 times, 10 times, 9 times, 6 times, don't count it. Forget coloring the baby stools every day. And urine, definitely you need to make sure that the baby passes urine every day 5 to 6 times. That means half the times the mother feeds. At least half the times. If she's feeding 10 times a day, baby has to pass 5 times. She's feeding 8 times, 4 times, the baby has to pass urine. So make sure that the baby passes urine. Stools, forget, and don't give any medications to fasten that.
ಓಕೆ. ಸೊ ಇನ್ನೊಂದು ಪ್ರಾಕ್ಟೀಸ್ ಏನು ನೋಡಿದೀನಿ ಅಂದರೆ ಅಂಬ್ಲಿಕಲ್ ಕಾರ್ಡ್ ಅದೇನು ಹೊಕ್ಕಳ ಬಳ್ಳಿ ಅಂತ ಏನು ಹೇಳ್ತೀವಿ. ಸೊ ಅದನ್ನು ಕೇರ್ ಮಾಡೋದು ಈ ಹಳ್ಳಿಗಳಲ್ಲಿ ತುಂಬ ನೋಡಿರೋ ಪ್ರಕಾರ ಪೌಡರ್ ಹಾಕೋದು, ಸೊ ಟು ಕೀಪ್ ಇಟ್ ಡ್ರೈ, ಇಲ್ಲ ಟರ್ಮರಿಕ್ ಹಾಕೋದು, ಇಲ್ಲ ಒಂದು ದಾರ ಕಟ್ಟೋದು. ಸೊ ದಾರ ಕಟ್ಟೋದ್ರಿಂದ ಅದು ಬೇಗ ಬಿದ್ದೋಗುತ್ತೆ ಅನ್ನೋದು. ಸೊ ದೀಸ್ ಪ್ರಾಕ್ಟೀಸಸ್ ಆರ್ ರೈಟ್?
See, umbilical cord ಅನ್ನೋದು it's a very it's an important connection between the mother and the baby. All right, so once it is cut, it will automatically go itself by 7 to 10 days. All hospitals, if the baby is delivered in any facility, will put a clamp to the umbilical cord. So dara kottodu, it's not at all a correct way. Okay, it is done only if in case of home delivery where there is no trained daya, andre trained anganwadi worker agli, dayis agli, who are birth attendants anta heltivi. Even in the remotest place, there are many government of India's initiatives that trained daya has to be there. Home delivery adrunu, they have to visit there and put the clamp, everything. Once they put the clamp, the blood supply to the cord is done and it will fall off automatically by 7 to 10 days, up to 14 days anta. If you take the generically 14 days anta itkoli, 2 weeks vargu the fall ಆಗಬೇಕು. ಅದಕ್ಕೆ to expedite fast and you could, there are practices in the villages, still there are, is to apply cow dung, turmeric powder, cream to to fasten that. Okay, or they think that it is wet and I need to do something. Dry cord care anta heltivi, dry umbilical cord care is the preferred method. That means you don't apply anything, ಏನು ಹಚ್ಚಬೇಕೇ ಇಲ್ಲ. You don't need to apply anything to the umbilical cord. However, if anything to be applied, if there is a risk of infection, something called chlorhexidine anta heltivi, or alcohol swabs which comes, and this is available in all the with all the birth attendants in their essential drug kit alli irutte idu. WHO mentions this medication as essential birth kit, idu irlebeku. is they apply to the umbilical base of the umbilical cord once a day for 5 to 7 days. That will prevent the infection which goes through the umbilical cord. Otherwise, preferably if you are living in a city, you don't need to apply anything. Leave it alone. Please don't apply anything. It is natural process of falling. It takes its own course.
ಓಕೆ ಸರ್. ಇವಾಗ ನಾರ್ಮಲ್ ಆ್ಯಂಡ್ ಅಬ್ನಾರ್ಮಲ್ ಬಿಹೇವಿಯರ್ಸ್ ಇನ್ ದ ಬೇಬಿ ಅಂತ ನೋಡೋದಾದ್ರೆ ಕೆಲವೊಂದು ಬೇಬೀಸ್ ಪೂರ್ತಿ ರಾತ್ರಿ ಪೂರ್ತಿ ಮಲಗಲ್ಲ. ಇಟ್ ವಿಲ್ ಬಿ ಕ್ರೈಂಗ್, ಇಟ್ ಈಸ್ ಕ್ರ್ಯಾಂಕಿ. ಸೊ ಕೆಲವೊಂದು ಬೇಬೀಸ್ ಇಟ್ ಸ್ಲೀಪ್ಸ್ ಥ್ರೂ ಆರ್ ದ ನೈಟ್, ಥ್ರೂ ಆರ್ ದ ಡೇ, ಆ್ಯಂಡ್ ಇಟ್ಸ್ ಆ್ಯಕ್ಟಿವ್. ಸೊ ಬೋತ್ ದ ಥಿಂಗ್ಸ್ ಆರ್ ನಾರ್ಮಲ್. ಬಟ್ ಕೆಲವೊಂದು ಸತಿ ಏನಾಗುತ್ತೆ, ದ ಬೇಬಿ ಇಸ್ ಗೋಯಿಂಗ್ ಆನ್ ಕ್ರೈಂಗ್, ದ ಮದರ್ ಡಸನ್ ಅಂಡರ್ಸ್ಟ್ಯಾಂಡ್ ವೈ ದ ಬೇಬಿ ಇಸ್ ಕ್ರೈಂಗ್ ಬಿಕಾಸ್ ಶಿ ಇಸ್ ದ ಫಸ್ಟ್ ಟೈಮ್ ಮದರ್. ಆ್ಯಂಡ್ ಅಜ್ಜಿ ಆಗಲಿ ಇನ್ನೊಬ್ಬರಾಗಲಿ ಏನು ಹೇಳ್ತಾರೆ, ಇಲ್ಲ ಗ್ಯಾಸ್ ಆಗಿಬಿಟ್ಟಿದೆ ಮಗುಗೆ, ಸೊ ಯು ಹ್ಯಾವ್ ಟು ಡೂ ಸಮಥಿಂಗ್. ಅಜ್ವೈನ ಡ್ರೈ ಫ್ರೈ ಮಾಡಿ ರೋಸ್ಟ್ ಮಾಡಿ ಅದು ಇದು ಮಾಡೋಣ, ಹೊಕ್ಕಳ ಮೇಲೆ ಹಾಕೋಣ, ಇಲ್ಲ ಕಿವಿಯಲ್ಲಿ ಊದೋಣ, ಇಲ್ಲ ಬೇರೆ ಅದು ಗ್ರೈಪ್ ವಾಟರ್ಸ್ ಆಗಲಿ, ಇಲ್ಲ ಅಜ್ವೈನ್ದ ನೀರನ್ನೇ ಕುದಿಸಿ ಒಂದು ಸ್ಪೂನಲ್ಲಿ ಹಾಕೋ ಪ್ರಾಕ್ಟೀಸಸ್ ಕೂಡ ಇದೆ. ಸೊ ಇದ್ರ ಬಗ್ಗೆ ಹೇಳೋದಾದರೆ ಸರ್.
See, babies crying 2 to 3 hours a day without any reason is normal. All babies will cry absolutely without no reasons 2 to 3 hours a day. It's a natural process. All right. Sleeping 16 to 18 hours a day is normal. And predominantly, as I told you before, babies do not have the circadian rhythm. Okay, they do not know the difference between day and night. So, and inside the womb, they're active during the night when the mother sleeps. So that same pattern is followed outside when they are delivered. So they are more active, alert during the night time, midnight till early morning, 5 to 6 a.m. That's when the babies cry, scream a lot. So you think whenever the baby is crying is there is some problem. Of course there could be that the babies are hungry, the nappy is wet, you need to change the nappy. There could be some pain. Okay, it could be colic pain, it could be ear pain. There are possibilities. Most of the times it is just they want you to handle, they want you to take care, swaddle, sway them, okay, on rock them. That's what they want. So do not get worried if the baby cries for 2 to 3 hours, provided it is consolable. Any consolable cry, you don't need to worry. When it becomes inconsolable, then there is something to worry about.
there's also a myth saying ನೀನು ಮಗುನ ತುಂಬ ಹೊತ್ತು ಎತ್ಕೊಂಡಿರ್ತೀಯ, ಸೊ ಅದಕ್ಕೆ ಮಗುಗೆ ಅಡ್ಜಸ್ಟ್ ಆಗಲ್ಲ. ಇಟ್ಸ್ ನಾಟ್ ಸ್ಲೀಪಿಂಗ್ ಎಟ್ ನೈಟ್ ಬಿಕಾಸ್ ಯು ಹೋಲ್ಡಿಂಗ್ ದ ಬೇಬಿ, ಕೀಪ್ ದ ಬೇಬಿ ಅವೇ, ದೂರ ಇಟ್ಬಿಡು. ಸೊ ದಿಸ್ ಇಸ್
keeping baby away is the most wrong thing you can tell to a mother. The more she takes closer to her, do skin to skin contact, especially kangaroo care, the more baby will have bonding, the baby will feel more comfortable than any other place. So that's what we need to recommend. Of course, provided the mother is clean, takes bath and she wears clothes which are very compatible to the babies and near to the babies, provided the baby has certain comfortable position to stay. So the baby need to be near the mothers. Going away from the mothers, the baby will feel separation, and that is absolutely not correct or recommended.
That will also affect the lactation process.
Yes, absolutely. The more when the mother hears the cry of the baby is what stimulates the hormonal production for milk. This is one of the important factors. She has to hear the baby cry to produce the hormones. So that's what is so very important, and every parent should know that.
Okay. Abnormal signs ಅಂತ ನೋಡೋದು ಹೋದ್ರೆ ಸರ್, ವಾಟ್ ಆರ್ ದ ಅಬ್ನಾರ್ಮಲ್ ಸೈನ್ಸ್
in terms of what? Like
baby's behavior.
Behaviorally. Okay, so again certain things, if you know that these are normal, then you will understand what are abnormal. Like sneezing is a sign that the baby, all babies will have sneezing. They think it is cold. Sneezing is a sign indicating that the baby is healthy. Hiccups are also normal in babies. Sometimes they overfeed, they fast feed, then they will have hiccups, and this is also absolutely fine to have hiccups. Straining during passing urine and stools. They strain, cry, become red and pass urine and stools. This is absolutely normal. Idunu normal irutte. That doesn't mean that baby have stomach pain and you need to give gripe water or whatever things. These are non-medical indicated, absolutely harmful things to be given. So do not give all those things. Straining is a sign because babies do not have control on the bladder and bowel. So they have to strain to pass the urine and stools. Otherwise, because the coordination, immature nervous system, immature bladder idre, control iralla. that will take some time to develop. That's why they have to strain to pass that. So straining is provided it gets better after they pass. So these are signs that the baby, and some small amount of vomiting, which is called curdly vomiting ಅಂತ ಹೇಳ್ತೀವಿ, reflux, that is also normal. So sneezing, hiccups, curdly vomiting, these are normal. Abnormal signs ಅಂತಂದ್ರೆ baby is vomiting frequently, greenish vomiting, blood in the stools, as I told you, abnormal color of the stools, baby has not passed urine for more than 8 to 12 hours, baby is not feeding and active, baby has lost weight, or baby looks smaller compared to when the baby was born. These are abnormal signs. Then you need to be worried and visit your doctor.
Okay. So ಇನ್ನೊಂದು ಪ್ರಾಕ್ಟೀಸ್ ನೋಡೋದಾದ್ರೆ ಯೂಶಲಿ ಸಾಂಬ್ರಾಣಿ ಇಟ್ ಈಸ್
Yeah.
ಒನ್ ಆಫ್ ದ ಬಿಗ್ಗೆಸ್ಟ್ ಮಿತ್
Yeah.
ವಿಚ್ ಇಸ್ ಗೋಯಿಂಗ್ ಆನ್. ತಾಯಿಗೆ ಸಾಂಬ್ರಾಣಿ ಹಾಕಿದ್ರೆ ಹರ್ ಸೂಚರ್ಸ್ ಹೀಲ್ ಆಗುತ್ತೆ. ಆ್ಯಂಡ್ ಯಾ ಆಫ್ ಕೋರ್ಸ್ ಇಟ್ ಕ್ರಿಯೇಟ್ಸ್ ಅ ವೆರಿ ಸೂದಿಂಗ್ ಎನ್ವೈರ್ಮೆಂಟ್
Yes.
ಫಾರ್ ಹರ್.
Yeah.
ಬಟ್ ಹೌ ಡಸ್ ಇಟ್ ಎಫೆಕ್ಟ್ ದ ಬೇಬಿ ಸರ್? ಮಕ್ಕಳಿಗೂ ಕೂಡ ಹಾಕ್ತಾರೆ,
Yeah.
ಬಟ್ ಇಟ್ ಹ್ಯಾಸ್ ಎನಿ ಎಫೆಕ್ಟ್ ಆನ್ ದ ಬೇಬಿ ಆಸ್ ವೆಲ್?
It has very detrimental effect ಅಂತ ಹೇಳ್ಬೋದು. That means it can cause only trouble to the baby.
Yeah.
Okay. Motherಗೆ if you give sambrani, it's a concept that it will help, providing that warmth will help the uterus to regain back to her original position. Normally uterus is dilated, now it has to come back if you give warmth. And that smoke and the smell of it will act as an, like pretty much like aroma, that healing environment.
Soothing environment.
Correct, soothing and healing environment, and also it prevents the bacteria invasion to the mother. Okay, that means antimicrobial properties, because in the olden days there was a lot of, in the air there was a lot of sepsis already there. So however, the smoke is so dangerous to the baby that it can cause effects on the lungs, breathing. There are a lot of allergies the baby can have. And some babies, yeah, I mean, I've seen a lot of babies in my own practice that the babies come with a lot of pneumonia with this sambrani.
Inhalation.
Yeah. So for the mother also, because you do not monitor the amount of smoke you give, what are the components, what are the allergic impact of this smoke, so giving that to the babies is absolutely contraindicated. For the mothers,
It's okay.
it may be helpful because of the warmth, but do not give smoke. You may give the warmth, but do not make it smoky.
In a separate room where the baby is not
Yes,
there.
but and do not make it smoky, too smoky, because she herself will have allergies.
Yeah.
She will herself have problems with that. Okay, so there may be a logical reason, traditionally. However, there are scientific basis not to do that as well. All right, for the babies, absolutely no. Mother may be beneficial with all the caveats as I told. You need to monitor the smoke. Do not make it smoky. You may have good smell, healing environment. If your house is clean and hygienic, you don't need to give smoke to make it hygienic, right?
Yes. You can use the organic one.
Exactly. So all these things. So definitely no for the baby from my side.
And one more question is, mother diet babyಗೆ ಎಫೆಕ್ಟ್ ಆಗುತ್ತಾ? ತಾಯಿ ಏನೋ ತಿಂದಿರ್ತಾರೆ,
Correct.
because of that the baby suffers.
Again, it's a common misconception daily come across. Most of the families will keep the mother away from most of the nutrition diet, which is I feel pity and also feel bad that this practice is there. It's absolutely wrong. All right, so all the mothers, once they are delivered, it's not a disease, which again I'm telling you, it's not a disease, a natural process she has undergone. Give her the normal diet what she was eating before delivery. Giving hot food, like spicy things will affect the baby. Giving cold stuffs will cause cold to the baby. Is as old as 100 years ago. So she should eat normal healthy nutrition diet. She may eat a cheat meal once a month also, that's fine. So eating normal healthy home, high protein, high fat, carbohydrate, because she has to have the nutrition which she lost, you know making her baby grow. She has to regain that. Her hemoglobin status have to come back to normal. Her calcium, her vitamin D levels have to come back to normal. Her protein requirement has to be met. So she has to have a normal diet without any restrictions.
ಓಕೆ. ಇನ್ನೊಂದು ಸರ್, ಬಾಣಂತನದಲ್ಲಿ ಮೋಸ್ಟ್ಲಿ ನೋಡಿರೋದು ಕಾಲಿಗೆ ಸಾಕ್ಸ್ ಹಾಕಬೇಕು, ಕಿವಿಗೆ ಹತ್ತಿ ಇಡಬೇಕು, ಯು ಹ್ಯಾವ್ ಟು ಕವರ್ ಯೋರ್ ಸೆಲ್ಫ್, ಯು ಹ್ಯಾವ್ ಟು ನಾಟ್ ಸ್ವೆಟರ್ ಹಾಕ್ಕೊಂಡೇ ಇರಬೇಕು, ಯು ಹ್ಯಾವ್ ಟು ಕೀಪ್ ಯೋರ್ ಸೆಲ್ಫ್ ವಾರ್ಮ್ತ್. ಹೊರಗಡೆ ಎಲ್ಲೂ ಹೋಗ್ಬಾರ್ದು, you're not supposed to meet anyone, you're not supposed to do normal activities which you were doing before. So talking about this.
Right. It's a again. It is pretty much is a myth. Straight away at the outset, it's a myth. Covering the ears because her face will get swollen is what is the myth. If you open the ears, that's absolutely wrong. Do not. There is no scientific basis for this. You can. She may she may have more. She may be more prone to infections in the first 42 days of life. That's what we call as puerperal period. All right, ಬಾಣಂತನ period ಅಂದರೆ 42 ದಿವಸ. Okay. So first 6 weeks nalli she is more prone for infections. All right. So because her immunity is getting back to normal and she is still not recovered. And there are certain complications which can happen in that period, 42 days ಅಲ್ಲಿ. ಅದಕ್ಕೆ that means she is not unnecessarily exposed to the environment because she can catch infections from the air like viruses or any bacteria. Doesn't mean she needs to go out out of the home. Doesn't mean that she has to wear socks or cover her ears all the
Not
times or
supposed
wear
to do the
gloves.
normal things.
She has to be as normal as possible. You are not going and jumping in a dirty water to catch infection. She has to be as normal as possible. She's more prone for infections. She's not completely recovered. That's why we call it as Banantanam period, right? 42 days. That means she's not normalized yet. But if you are not normalizing things, how will that normalize?
Exactly.
That's why we call it. If she has to go to that normal level. How will she do that? Not restricting her diet, not giving her what she wants, making her feel comfortable, and treating it as a disease. She's in separate room somewhere. Okay, visitors should be avoided. Not that she has to be isolated.
At the end of the thing, ಇವಾಗ 1 month ಆದಮೇಲೆ ಬೇಬಿ ಮನೆಗೆ ಬಂದು ಡಿಸ್ಚಾರ್ಜ್ ಆದಮೇಲೆ when should be the next visit to the pediatrician?
See, ideally, if all the facilities, if you are living in a luxurious city like Bangalore where the doctors are available so early, it is in the immediate neonatal period, andre 3 to 4 days after discharge for the weight check on the jaundice check. Idu immediately, even in the peripheries where the birth attendants attend the on 5th day, 3rd day, 5th day, 7th day attend ಮಾಡ್ತಾರೆ. So that is the, if not possible, that is the ideal thing. If not possible, so at the end of first week you go to the pediatrician to check for the weight, you check for the jaundice levels.
Every week ಮಾಡಬೇಕಾ?
First week. And then if the pediatrician is comfortable, okay, you don't need to, then he will call you after 2 weeks for a second check for the weight gain and whether breastfeeding is going all right, if the mother has recovered back to her normal status, or if there are any concerns with the baby to detect. That is the second visit. Afterwards, it is all tailor-made. Okay. We call for vaccines if the baby is not have any problems in the newborn screening test, or if the baby has not passed the hearing test, or if the jaundice levels are high. That is all tailor-made depending upon the condition of the baby.
Okay. So to conclude this program, I would like to ask you, what is your happiest and most scariest thing which you have seen in your profession?
See, being in a neonatology and dealing with babies for almost 12 years. So the happiest thing I would say is when a very sick baby, almost at the, I myself have resuscitated babies who do not had any heartbeats. And then going home and now seeing them walk and coming, that is probably the happiest thing, is the babies who did not have heartbeats at birth. And absolutely flat, no breathing, no heart rate. And maybe when we give them the first breath and they start crying and then getting discharged, would be the happiest moments, is to give for the first breath if the baby is not crying. Would be my happiest moment, is when I give them when they start crying, when they give the breaths to them and they start crying.
That is the happiest moment for the mother as well as for the doctor.
Absolutely, anyone. If the baby is, as soon as the baby is there, the baby is not crying, because I told you the pediatrician is mandatory, because in the first minute, if you don't give a breath to the baby, it will have permanent damage to the brain. That's why it's called first golden minutes. ಮೊದಲ ಸುವರ್ಣ ನಿಮಿಷ ಅಂತ ಹೇಳ್ತೀವಿ. ಅದರಲ್ಲಿ ಬ್ರೆತ್ ಕೊಟ್ಟಿಲ್ಲ ಅಂತಂದರೆ ಆಮೇಲೆ ನೀವು ಏನು ಮಾಡಿದ್ರು ಯೂಸ್ ಇಲ್ಲ. ಬೇಬಿ ಉಳಿಬಹುದು, ಓಕೆ, ಬಟ್ ಅದು ಬ್ರೈನ್ ಮೇಲೆ ಅಷ್ಟು ಇಂಪ್ಯಾಕ್ಟ್ ಆಗಿರುತ್ತೆ, ಇದು ಲೈಫ್ ಲಾಂಗ್ ಇಂಪ್ಯಾಕ್ಟ್ ಉಳಿದ್ಬಿಡುತ್ತೆ. ಸೊ ದ ಫಸ್ಟ್ ಮೂಮೆಂಟ್, ಸೊ ವೆನ್ ಎವರ್ ಬೇಬಿ ಇಸ್ ನಾಟ್ ಕ್ರೈಂಗ್, ಅವರ್ ಇಯರ್ಸ್ ಗೋ ಅಪ್, ಅವರ್ ಅಡ್ರಿನಾಲಿನ್ ಪಂಪ್ಸ್ ಇನ್, so that
it's stressful for both the pediatrician as well as the mother.
Definitely. For the baby is much more. I told you, baby secretes adrenaline, which is much higher than what we can ever produce in our lifetime. So that is one is the happiest moment, and the saddest moment is when I am unable to do that. Despite everything, if the babies are not breathing all right, and some, of course, maybe in 100 babies I may lose one or two babies, all right, which will not respond to how much ever we do it. And especially if they are very small, like what we deal with, a lot of babies who are very small, right, from 500 grams, 600 grams, all those babies, when we are not able to save even a single baby of that, that would be perhaps our saddest moment.
Stillbirths ಅಂತ ನೋಡಕ್ ಹೋದ್ರೆ ಎಷ್ಟು ಪರ್ಸೆಂಟೇಜ್ ಇದೆ ಸರ್
See,
ಇವಾಗಿನ?
it depends. In India, and stillbirth is very high, all right, and especially when you go to the.
ಸ್ಟಿಲ್ ಬರ್ತ್ ಅಂದ್ರೆ ಏನು ಅನ್ನೋದು ಸ್ವಲ್ಪ.
So these babies do not have heartbeats at birth, do not breathe at all. So potentially, just before delivery, they would have already, passed away. So immediately after, they will not be considered viable ಅಂತ ಹೇಳ್ತೀವಿ. ಅಂದರೆ they have no heartbeats at birth. Immediately after delivery or even just before delivery, their heartbeat have stopped. In a simple language, if I want to say, delivery ಆದ ತಕ್ಷಣ, when you give breaths, they will not respond. So most likely we call them as stillbirths.
Okay. Thank you. I'm so grateful and happy to have you here, sir. Thank you for sharing your knowledge about so many things. I'm really happy. I look forward to have you with us in many more episodes, sir.
I think that was a fantastic discussions. Your questions were so spot on, and I think most of the questions what I encounter and I want to answer to most of the parents, which I fail to do so at a larger audience. I think this will help, is what I feel, and wonderful. Congratulations on doing a wonderful job.
Thank you, sir.
And best wishes to all the Janani Seva team.
Thank you, sir. Life is a circle. The end of a journey is the beginning of next. So this end of our today's discussion marks the beginning of our podcast series. Today we spoke about the first month after birth. Stay tuned to learn more about postpartum health and wellness. Please like, share and subscribe to our YouTube channel if you found this informative. If you have any queries to be addressed, please comment below. Thank you.